Welcome to Who Let the Dogs Out. Today we've got a special episode for you. We're interviewing Dr. Sally, and this is somebody that's very special to both me and Sally, of course. And we can't wait to tell you about her and share what she does with you and your family. So anyways, with that being said, enjoy the show. Who let the dogs out? Who let the dogs out? Welcome to Who Let the Dogs Out. The podcast is designed to help you enjoy life with your best friend without all the frustrations. Join us each week as we help families across the country do just that. I'm your host, Corey, and I'm joined by my co-host,
Sally.
And today we've got a third Sally on the show.
Yay!
Welcome to the show, Dr. Sally.
Thank you so much.
Okay, well, I've got a bio that you sent me, and like I said, I kind of spruced it up and added a little bit of, how me and Sally both know you. So with that being said, joining us today is Dr. Sally, who has traveled a long and winding road to get here. She's originally from New Orleans and worked at the Memphis Zoo and eventually through the halls of LSU, where she earned her DVM. She's practiced everywhere from Massachusetts to Mississippi, but it's her work with Lap of Love that truly defines her impact. She provides a level of compassion that's hard to put into words, and me and Sally both know that firsthand. Mm-hmm. She recently helped me lay my sweet dog Mia to rest, and she did the same for Sally's dog Mabel a while back. It takes a special soul to bring that kind of peace to families during their hardest moments, but we're very honored to have you on the show. So anyways, welcome, Dr. Sally.
Thank you so much. I appreciate y'all having me on today, and absolutely, both your babies still hold a very special place in my heart.
Yeah, I remember whenever you came over. I mean, Sally was over there with us that day as well, or whatnot. But that was like one. She'd been asking me to have you on the show for a couple years, and
I have.
I appreciate that.
Yeah, because we talk about everything dog, but we never talk about the inevitable that's going to happen, and it comes round quicker than we think sometimes.
Definitely does.
It's not exactly something we want to think about,
No.
and you know what? That's okay. I will be the first to acknowledge if we thought about it all the time, it would make our relationship with our dogs and cats and animals very difficult. But the fact of the matter is, our animals live in the moment, and so they do this amazing thing where they pull us into the moment with them. So a lot of times we are not thinking about the end of life for our pet, and that's okay. That's a good thing. But when that chapter is approaching, we definitely at Lap of Love, we want our families to know why we're there, what we can help with, all those good things.
Yeah, it's a very unique and niche service. Have you ever heard of anticipation grief?
100%. And
yeah. Because that's very real, and I will say, I mean, I had that for like years, way before Mia actually crossed the Rainbow Bridge, you know? I mean, I had that for, years and years. So I probably did think about the end of life a little bit too much. I will say it didn't really help very much, though, either, you know?
Anticipatory grief is one of the heaviest weights we will ever carry in our life. It's for myself, who is very versed in what that means. It felt like I had, literally a 20-pound weight on my back or on my chest at all times, when my dog was at the last stage of her life. So when people say, gosh, we've been dreading this day, I know dread does not even begin. You feel ripped apart on a daily, especially when you're seeing a pet that is walking through chronic disease states. And every little milestone of that disease makes you go, and you just feel the reality of the situation. So I understand. The anticipatory grief could be an entire conversation by itself.
I clearly when you get a dog, they're going to die at some point, and it's like, you don't really think about, it's kind of like whenever you're getting older as a human, right? Whenever you're young, you think you're
100%.
invincible and you're kind of dumb and stuff. And as you get older, you're like, okay, well, I'm a lot less invincible than I thought I was. And as you, near it gets closer and closer. And I think the same thing, happened with Mia where, I guess where I was headed with that is like 3 days before you're supposed to come out, it was Wednesday night, it was 10 p.m. and you were scheduled to get to our house at Saturday at 10 a.m. And I was like, that's 60 hours, and then I woke up the next day, and then whenever 10 o'clock rolled around, I'm like 48 hours, then 36, then 24. And then the morning of it's like 6 hours, 4 hours, and it was just, golly, the anticipation was by far the worst part of the whole thing, definitely years out for sure, but definitely, hours before it's like, I don't know. I don't know if that's a blessing or a curse that I got to plan it, or if I would have rather it just happened a lot more suddenly. And it was, I don't know what would have been better, but I'm sure they both would have sucked regardless.
I tell people all the time, whether we say goodbye because of a sudden trauma and we had no time to prepare. I've had animals go that way, where everything's fine one minute and the next minute they're just gone, like that.
Yeah.
That is a different. I think there is a difference in that grief versus a chronic illness where we have been medicating, managing, acupuncture,
Right.
therapy. We've been doing all the things to support their body for as long as we possibly can.
Yeah.
But we are also able to help them by protecting them from the worst day,
for sure,
or prolonged struggle. And so they're different types of grief because of that level of anticipation that we kind of unfortunately carry on our hearts.
Yeah.
But then the problem with saying goodbye very quickly is like, man, I'll use like one of my cats was, unfortunately, she was on a screened porch. She was in a safe place, but a predator came in and literally took her out of that safe place.
Golly.
So that was very sad, and unfortunately things like that happen.
Right.
But you just feel like, man, do I blame myself for letting her go out on the screen porch? Do I that happens, but the grief is a little bit like, oh, that's terrible. I didn't get to spend that last day with her. I didn't know that was going to happen. So there's different types of grief because of the road that we walk with our animals.
Yeah.
None of it is easy, to be clear. None of it is easy, but it doesn't make one road less important than the other.
Yeah. Well, so I think I didn't put the year in the bio that I made, but you graduated from LSU with your DVM in 2014. Was that right?
did, yeah.
Okay, gotcha. So I guess it's 12 years now or whatnot.
Crazy. That's crazy.
Yeah, right.
Time flies.
So you're in a very niche service now. You specialize in end of life care and helping dogs transition from life to death in people's homes, which is amazing. But first, I guess starting off, so what made you want to be a vet in the first place? Because you had went to college a couple times before that. Because you came to Memphis for CBU, then you got a master's, and then you did veterinary care on top of that. So you've been in college a few times, yeah, right. So. Yeah, what made you want to be a vet? I mean, because you had a master's in something else, and then I forget what it was in exactly. What was it?
Yeah, so I was trying to get into vet school, and while I was doing that, I was like, well, I have this other degree program that has accepted me, sure. And so I went and got a master's in public health.
Gotcha. Okay.
And that was a great experience because it actually opened my eyes to a lot more in terms of opportunities, because I still wanted to go to vet school.
Right.
But when you kind of walk into the field of public health, you realize like, wow, there are veterinarians in public health. There are vets that work for the CDC. There's vets that work for...
That would make sense.
Yeah.
I guess it's just something that regular people like us just don't really think about.
Oh, yeah. Food security. Yeah. Veterinarians work in it. Vaccine development. Veterinarians work in it.
Yeah.
I worked with a wonderful CDC vet who her job was to go out and survey bats for rabies.
Interesting.
Like, whoa, that's crazy,
Yeah, I just watched a documentary on rats last night in New York City, and there's vets that do that.
Yeah. So
anyways,
trying to maintain infectious disease, like these are all roles that veterinarians do play in order to keep the public health, at not just the animal health, but also human health under control. And so I did that master's, and then I did get into veterinary school. Which is
quite a feat in itself, because vet school's not easy to get into. It's quite challenging from my understanding.
To be very honest, it took me 3 times. I got in on my third try.
Third time's a charm.
Yeah, third time's a charm. I never wanted to give up on pursuing it because going back to your initial question, even as a kid, I never wanted to do anything else. That was, I may have deviated slightly in my teenage phase when all girls want to be marine biologists and swim with the whales at all times. But it was always, for me, it was a very clear and firm, I want to be a vet. And I think that's mostly because I was a kid that didn't mind human friends, but when it came to what my preference was, I would much rather be hanging out with the local street cats or the doodlebugs in my backyard, or I was not allowed to have a dog until I was 13.
Okay.
You can guarantee, like, that's all I thought about as a kid was when I was going to get my first dog.
What was the first dog?
My first dog was a Heinz 57, a little black mutt. He came from a pet store. My mom was actually on her way to pick up a purebred Jack Russell Terrier, very, just very hoity-toity little puppy. And she passed the local pet store and said, let me just see what's available. And she went in and there was just a litter of these little black puppies.
Wow.
And she picked one and said, this is him. And there's a picture of it, me receiving him, just bawling my eyes out. And my little sister's over here. She's literally giving me this look like, what is wrong with you? You just got this puppy that you've wanted all your life. Why are you crying? And I just bawling. And so that was Rocco. That was my first dog.
Wow.
And
clearly a good experience.
Wonderful experience. You know, up until then it was hamsters and lovebirds is what we were allowed to have, and a cat. And I loved them all, but I really needed that dog in my life.
Yeah.
So, but yeah, that was, you know, growing up, it was always animals for me. And so veterinary medicine was always my end goal.
Wow.
So hence the reason 3 times the charm when it comes to getting in.
Yeah. Wow.
Yeah.
So from vet school, so then I think you had said that you did an internship in Nashville, right? Okay. Tell us about that.
So that is an interesting experience because just like medical school, when you graduate veterinary school, now to be clear, medical school, it is human medicine. You are more so required, I believe, to do further education.
Yeah, because you're a doctor, then you're a resident, and then if you really want to specialize, it's like a fellowship.
Correct.
You know? And then you're like a doctor making doctor money.
Yes,
after that.
You don't have the option. Maybe you do. I don't know, but you don't have many options in terms of I graduated 4-year med school. Off I go. You know, most of the time the doctors are going to be expected to pursue higher education through internship, residency. Veterinarians do not have to do that. But
so you could have just graduated and went right into like general practice.
Yeah, absolutely. You can jump into general practice and essentially be on the job trained.
Right.
If you. But for me, it was really more, I just wanted more experience. I wanted more hands-on time. And so my internship, you are matched just like medical school. So you can apply to 10 different internships, but the algorithm is going to choose where you end up.
Interesting.
Yeah.
So I was, honestly, I was kind of hoping to get over here in Memphis vet specialist, but I matched in Nashville.
Is Nashville vet specialist like the same one as Memphis, basically?
It's
is
very
it like
similar.
A chain? Or I didn't know if that's like a franchise, like MVS.
Yeah.
NVS. I didn't know.
Nashville, when I was there, was privately owned.
Interesting.
I believe they have, don't quote me on that, but I believe they have become a corporate at this point. But at that time, it was owned by two veterinarians.
Interesting.
Mm-hmm.
Is it like, is that one similar to this one, or it's like basically like an emergency hospital?
Yes. Well, a combination of emergency and critical care, as well as having specialists that strictly work in that building.
Okay. Gotcha.
So, and there may be different specialists depending on the location that you go to for a specialty hospital. So when I was at Nashville, yes, we absolutely saw tons of emergencies, but we also had an ICU specialist, who was there just to manage those really high risk cases.
Yeah.
We had 2 internal medicine specialists. We had 3 surgical specialists, dermatology, oncology.
Wow.
They were all, and neurology. They were all within that building. So it was really wonderful because
that's quite the basket of specialists.
It is. It really is. And what you do in a 1-year internship is generally you're going to be rotating through those specialties.
Right.
And then the goal is if you come out on the other end of that 1 year and you say, gosh, I really enjoyed neurology, then you can start applying for, okay, now I want to do a residency because I want to be board certified and whatever.
Mm-hmm.
For me, the internship was really more about experience, getting my feet more like grounded in general vet med. And it was a really good experience. Internship is tough.
Yeah.
Internship
is it like residency in the sense that like you're working all the time?
All the time. Yeah.
Yeah, because I know with residents, like we had Casey work for us for a couple of years, and her husband was in residency here to be like a specialized surgeon or something. He was gone literally all the time.
All the time.
All the time.
You're on call all the time.
Yep.
Like you are the workhorse.
Yeah.
They're not there to cut you any slack. If there's you don't get, we at that time did not get days off. There were no designated days off. There might be a day where you didn't have to come into the hospital, but you were still on call.
Right.
And so most of the time you're going to get called in.
Right.
And so now there are way, as in human medicine, veterinary medicine is becoming more protective of interns, residents.
I know human medicine is for sure.
Yes, they have to get a certain number of days out of the hospital.
Right. Yeah. I just went to dinner with some doctor girl that's in residency, right? Or she's in school for a doctor right now. And she was kind of telling me about it, like for just how the workload's still crazy, but less crazy than it used to be, basically.
Yes. There are different things in place to kind of say, yeah, really, like give them a day off. It's okay.
Yeah.
So that was a good experience, but definitely one of the toughest years of my life for sure.
I think in the text that you sent me, you were there for 3 years, right?
The internship was just 1 year.
Just 1 year.
Yep,
okay.
just 1
Did
year.
you pick something that you were like, I like this the most out of all that stuff?
I didn't. I kind of actually came away from it thinking, okay, I know a lot more now. I have knowledge for a lot more, but I don't think I want to pursue a residency. I didn't want to specialize. And so really, if you're not gonna do a residency, it's kind of like, well, I'm not gonna do another internship.
No, that makes sense.
Yeah.
So, okay, I might have had it wrong. So did you then go into general practice? Was that what you did right after that? Okay,
yeah.
gotcha.
Yeah, so then I felt more confident about like, all right, let's practice some medicine. I feel
Did you
like
do that
that's
here or
a
in
lot.
Nashville?
Actually, back in Memphis. I moved back to Memphis, and I applied to a bunch of general practices in the area, all of which really impressed me. I ended up over in Cordova working for a clinic there for just about 2 years, like 18 months to 2 years.
Nice.
And then realized that, then I found Lap of Love and I started making the transition. And during that time, I actually did relief for a while, which is where you kind of go to whatever hospital needs you for a day, a week.
For Lap of Love or just overall?
Just general, yeah. While I was making the transition to Lap of Love, I needed a little time filled in.
Yeah, a little buffer. Yeah.
And I loved doing relief. I thought it was great because I got to work at various practices. I got to meet new people. So I still occasionally will relieve every now and then because it's nice to get into that clinic mindset, when you can.
I feel like Dr. Melanie does that. Dr. Fisher that does acupuncture. I don't know if she does it at a bunch of hospitals. I know she fills in sometimes at like a clinic, and I feel like she takes emergency shifts every now and then too.
I think she does too, which is brave because internship definitely told me I don't want to do emergency.
Okay, I'm glad you brought that up
intense.
because I had 2 follow-up questions. One was about general practice, but like I imagine being an emergency vet probably, I think if I was just talking to Ethan about this, I'm like, I don't know if I'd rather like do Dr. Sally's job or I had a plumber at the house this morning or be a plumber. Both of which sound like jobs that I'm like, I don't know if I'd want to do either one of them. And I'm excited to learn. Anyways, where I was headed with that was, I imagine being an emergency vet would be way harder than doing general practice or even what you're doing right now, which seems like the toughest. But like if your dog comes in with like a broken leg or a bone exposed or like, families are on edge. It clearly is an emergency. There wasn't any prepping for it, that's got to be tough.
It can be very hard. What's interesting is I sincerely don't think it's the cases that you see. It's sometimes just the utter speed at which things happen.
Yeah.
Because, it's one thing to say, okay, we have a pet coming in they need emergency management. And if nothing else is going on, wonderful. I can dedicate all my time and energy to this animal. I can use all of my skills and resources, and we're just going to get this dog or cat or ferret or parakeet or whatever it is. We're going to get them through this and we can focus on them. Emergency, though, a lot of our vets it's just one thing after another. And it can be, that was really what was the pressure. The pressure points were really in how much was coming in all at one time, so that's,
I could only imagine.
There's a lot of you'll hear and see this in the veterinary world. You never say it's a quiet day, because it's like the whole staff just goes, oh no, like you just ruined everything because it's all going to start coming in at once. And so that's undeniably, I think that was the toughest part about being emergency was that like when it just flows in, it's just everything just feels like you can't keep up.
Yeah, it's like the lunch or dinner rush at a restaurant or something.
It is,
where you're like,
yeah, and it works that way in human medicine. I mean, emergency vets are very incredible and special people because they can not only address situations medically, but they can manage their time and just keep going through the flow. And that's really the toughest part sometimes is just keeping yourself calm so that you can better serve your patients.
Yeah.
And so don't get me wrong. I worked in urgent care, which is a little different because essentially,
like a step down.
Yeah, it's like a step down where you are seeing those pets that need you, but if they need care that's overnight, I would have to send them to the full service emergency hospital. So I'm not going to be there going, okay, I'm going to do an emergency surgery, but I will say I can help diagnose you, but then I'm going to have to send you down the road because your pet needs X, Y, and Z, and we're not equipped to do that. So it's kind of that middle ground, which is not to be taken for granted. It's still important because at least we get a diagnosis and we get initial management. But I was always like, you don't want my hands in surgery, like that's very clear. So there's a reason I don't do surgery. I don't mind it, but that mindset is not mine. So I think that it's wonderful to work in emergency. My hat's off to emergency veterinarians because they hold it together. They really do.
They sure make some money though. Not the vet. I don't know about the actual vets, but I'm just talking about the vet's office because Mia, golly, I mean, if I could total how much that dog cost me in my lifetime between emergency vet visits, like
I totally understand
it's
that.
the craziest thing. The craziest one that ever happened was she got sick a couple times randomly or whatnot, but we were doing like a family workout. We're doing cold plunges after, and my dad threw the Frisbee, and I just bought a brand new truck. And my dad threw the Frisbee, it curves, and Mia's running around, and she literally slides through the mud and runs into my truck full speed.
Oh,
and she's like walks away limping and stuff like that. And I didn't recognize how bad it was at the time. Clearly it was a bonk, but like I didn't realize how bad it was. And so then I had to like load her up in the truck. And when I loaded her up in the truck, I'm like, oh, she's messed up.
She's
So
hurting.
then fortunately that wasn't the emergency vet. That was just the regular vet. But,
Good.
But I could not imagine. Cause I was so on edge. Like I held it together the whole way to the vet. And as soon as the dog walked out of the room Karen, I don't remember what happened, but as soon as the dog was out of the room, I broke down, but I like held it together while she was around. I wanted her to know that I was freaking out or upset, but the emergency vet. Anyways, I was saying all that to say, man, that dog has cost me some money over the years.
I know. And I would love to tell you that, it's hard because that is one of the concerns that every veterinarian will be faced with is, clients' concerns about finances.
Oh, yeah.
And my God, if we could take anything off of the plate of our clients, it would be the financial aspect of things, just to be like, yes, we will do it all for free. But, and unfortunately, just like any
it is a business
thing, it is a business, and cost is sometimes prohibitive. But we will always try to find avenues that, okay, well, if we can't, I was taught by an emergency doctor during my internship. She gave me a great way to approach that when costs needed to be considered. She would always say, you offer them options based on cars. So we can do the Cadillac car option where we do all the things, where we do the MRI and the surgical consult and the neurologist, and then we go and yes, this may be like a $20,000 bill,
At the vet?
Oh yeah,
no
absolutely,
way.
Yeah.
Okay, maybe it didn't cost me that much money.
Yeah, no, it's all relative. It's relative to what's going on.
Yeah.
But then you could say, well, we don't have to do the Cadillac plan,
right?
But maybe we could just do the what a
Chevrolet would
say
be
my
a GM
Subaru.
brand.
Yeah, like a Subaru plan, which is going to be, let's start with some X-rays and some blood work. We're going to do some diagnostics, but we're going to funnel most of our funds to treatment,
right? Whether
that's pain management or referral, to another clinic if we need to. And then we've got we kind of, we're in a situation right now. We've just got to focus on what can we do to get them stable and comfortable.
Right.
And then we'll cross that next bridge later.
Right.
Okay, so we're just going to do the
electric scooter plan.
Yeah, electric scooter plan. And that helped me a lot to communicate with clients in those situations, because you never want to assume that somebody can or can't do something. You want to give them all their options and help them decide what's appropriate for their pet, right? Because that's the goal.
I imagine care credit was such a big thing though for vets offices and stuff, just because like I'm not a big credit card guy, but just at least being able to offer that. Because I remember, back when I was a kid, it was like, this is the bill.
I know.
You can pay it. But now it's option. Care credit fortunately does offer a lot of flexibility to people.
And pet insurance.
Yeah, pet insurance
can be
my
a
next
game
one I'll
changer.
definitely get pet insurance for.
Yeah.
By the time I thought about it for me, she was, too old.
Same thing with mine. Cassie was my girl, and I think about like, oh, if I'd had her on insurance, I probably would have not gone broke from her acupuncture for, the last year of her life. Like that would have been nice. Now that we have a German Shepherd, 100, I was like, we're getting her insurance immediately. Like,
give me the Cadillac insurance. I
yeah,
want the
I was
Cadillac
like,
insurance.
we need insurance because she was a mess when she was a puppy.
Oh, yeah?
Like, she was a mess. She was a street puppy. So
Mia was also a mess when she was a puppy. Yeah.
I think German Shepherds and like working breed dogs.
Yeah.
But I was like, insurance immediately for this dog. Like I know she's gonna kind of run into some problems. So
is there something too, like at emergency medicine, like if a dog's sick where they're just like, all right, let's just do a bag of fluids? Because I feel like that was like, honestly, most of the time ever took me in for like a fever or being sick or something. It was literally just like a bag of fluids. And the next day she was just better after a bag of fluids or something.
sometimes it can be something as simple as they need some supportive care, right? So our body is trying to compensate for whatever's going on, and we just need to give them a little supportive care, and maybe they do just kind of say, I'm fine the next day. Generally speaking, I would always say diagnostics are going to be helpful to better guide any kind of treatment plan. But understandably, yes, blood work is expensive. X-rays can be expensive. It's always going to be the doctor's always going to recommend what they feel is best, best case for the pet to guide them on what decisions to make medically, right? And so I very much understand the cost involved can be overwhelming sometimes. I wish there was more resources and opportunities for folks to say, well, I have this, like care credit or even better, but I certainly, I will say this, I don't think any veterinarian that I've ever met has wanted to run up a bill for the sake of running up a bill. You know what I mean?
Oh, yeah. I've always been under that impression too.
Yeah.
They come, every vet I've ever been to does give you options like you're talking about.
Options.
It's like, here's the low one, middle one, high one, and, fortunately for me, every time, Mia had something wrong, I'd be like, do literally whatever needs to be done and I will take care of it, know, but I understand that's not the way for everybody, but
but I think that the bottom line is we want to provide the best possible care and the care that supports the animal in the way that it needs to be supported.
Sure,
you know what I mean? Like, I was asked yesterday by a client, would you, they're considering chemotherapy for their dog. And she said, you'd tell me if you thought this was a bad idea, right? And I said, I would. Because if I think about my dog, my female, this was after Rocco, Cassie, we battled kidney disease with her for a year, and I made the very conscious decision, her kidneys are not going to last forever. Right. If she develops cancer, she was 14. It's always a possibility, but I was like, if anything past this happens, I'm not going to put her through chemo. We're not doing surgery, and I think that's appropriate because chemo would have killed her kidneys faster, and so it's that kind of thing where we want to make decisions that are within the realm of, are we doing the best possible thing that can give the dog the best chance, right? For my dog, chemo would not have been the right choice. If we'd come up against that wall, I would have said, no, we're not going to do that. We're going to continue managing her kidney disease, and we'll manage whatever signs we can with her cancer until we decide it's time to let her go. Versus, I'm very hopeful that this pet, who is otherwise very healthy, but we need to address this cancer, and we need to do it as soon as possible if we're going to have the best possible outcome, right? Yeah. So, but we don't have kidney disease, we don't have heart disease, we don't have these other comorbidities that would create doubt in my mind that this is the best route at this time.
Yeah. That was actually one of the questions that I didn't have on the list, but I kind of wanted to follow up with was like, how do you, I guess, in those situations, whether it be in life care or emergency medical care or whatever it is, what would you say would advice to be to somebody that's in like a patient's shoes where it's like balancing like cost / kind of what's best for the dog? Because like clearly if budget's a big factor, then it's like, well, I can only go so far in terms of budget. But then also like, let's say that budget wasn't a concern. What would you say would be like, is the line different for everybody? Because like my line for Mia was like, I'm not going to let her pee and poop on herself, And like, as soon as I started seeing that become a symptom, that's where my line in the sand was, where it's like, it'd be better for her to just go. I don't want her feeling bad all the time about, the bladder issues and stuff. Anyways, I guess that's kind of the question is like, is the line different for everybody? Do you help people draw where the line should be? That kind of thing?
It is such a personal decision, 100%.
Yeah.
The lines in the sand vary immensely. Now, I will say that if I walk into a home and I'm like, I think we're misdiagnosed, or maybe we're up against something that we could do something differently. I had one family that I legitimately said, I'm sorry, but euthanasia is not the right decision today, because what they were seeing was, it's actually behavioral. They thought they were seeing aggression from this dog. And actually, it was just a resource issue. They did not have a fence, so the dog was just running out the door and, and approaching people on the street. So what they were seeing as aggression, I mean, I met the dog, I spent time with her, and I was like, I think that this dog's just really social and
just need some underdog training.
Yeah. It has no understanding of appropriate manners.
Right.
Yes, she's jumping on me, but she's not giving me any indication that she's resource guarding or anxiety driven or anything like that.
Yeah.
So that was a situation where I was like, no, I think we just need to rehome her. I think she needs a house where she has a fence and where, and it was a lovely lady who had adopted her, but she was told the dog was a couch potato. I was like, this is a 2-year-old pit bull. She's not going to be a couch
Definitely
potato
not a
for
couch
years.
potato. Yeah.
So that those things happen. But the lines in the sand, I do have that discussion with families a lot, because lines in the sand can depend on the not just the owner's situation, to your point, not just the budget. It can very much depend on the pet's personality. It can depend on how, the support system that may or may not be there for that owner. If you have a pet who needs who needs insulin twice a day,
My family's weenie dog.
Yeah. That's sweet. Oh, I remember.
Oh, the weenie dog was out. Yeah. She literally gets insulin
Precious
twice a
angel.
day.
Mabel was on shots for diabetes. Coming towards the end of her life.
Yeah.
Anyways, but support system.
But if you don't have, say, if you have a situation where, Doc, I work the night shift, I start at 3 p.m. and I work till 3 a.m. My dog doesn't get to go out. I have no family, no friends that's going to help me come take care of my dog, who can give injections, who can let them out more frequently because they have to use the bathroom 8 times a day now. That might be a line in the sand.
Ugh,
I can't,
nice.
Because ultimately it's about preventing struggle for that pet.
Yeah, because you do have to consider the dog.
Yeah, I can't
Quite
no veterinarian is going to say, well, that's fine. We'll just go without insulin and we'll just let them, urinate all over themselves. It's not going to, that's not the answer,
Yeah.
My line in the sand for Cassie was, she started telling me she was tired of getting her fluids every day. And, if the fluids were incredibly important for her kidneys.
You mean fluids like the big hump
under
on
the
their back?
skin? Yeah. So with kidney disease, fluid therapy is like the foundation, right? Because the kidneys are working in reverse. They are letting all the nice hydration out too quickly, and they're keeping in all the pollutants, essentially. So they're doing the reverse of what they're supposed to do.
Yeah.
So fluid therapy for kidney disease pets in general is the foundation of management. It's not always easy. Trust me, I have one cat that I'm like, I don't think she's going to let me give her fluids without losing some fingers, if we ever come to that. But Cassie was always very cooperative. She would jump in the same spot every morning. We'd do her fluids, get her a little bolus, and then off she goes, eat her breakfast. So one of my lines in the sand was, baby girl, when you tell me you're tired of this, I'm going to listen to you. And sure enough, she started jumping off, but then, she'd jump in her spot, but then she'd kind of like see me with the bag and the needle, and she'd, move away from me, start jumping off the couch. So that was kind of one of my signs of like, she's getting tired of this, Appetite was also part of it. I wanted her to be able to enjoy a steak on her last day. And I knew if I waited too long, The kidneys are going to take her appetite completely, you know, and I'm not going to be able to get it back. So that was a line in the sand. I was like, she's going to have her steak. So we had to make that decision based on, we all have to make this very important decision based on what our lines in the sand are. And again, that line could be based on the disease itself, whether heart disease, you know, heart disease is a very scary disease. Respiratory disease can be very scary because it can change so quickly. Right. So that line in the sand may need to be moved up a little bit in order to prevent an emergency. Right. You know, the line in the sand can be based on what's going on with our support system, our family. Right. You know, I hate to say that, but like sometimes lines in the sand come down to, we've had this dog for 6 years. We know that they're somewhat aggressive, have some tendencies. Now we have a young child in the house. There was one strike. You know, is that our line in the sand to say we can't keep him any longer in the home? Whether we can rehome him or not is wonderful, but fact is we can't keep him here because now we have a child in the house. There's lines in the sand that may move and adjust, but the bottom line is speaking with your vet is so important to help better understand where that line is appropriate to draw. Sure. Because again, the disease process is particularly important to understand what may come from waiting too long past that line, if that makes sense, you know?
Yeah. I'm sure some people I feel like, I know for me, I feel like I picked like the sweet spot where it's like she still had like a quality life, even with the like back leg mobility issues, and like, but didn't get over the hump to where she was, you know, peeing and pooping on herself every day, right? So I feel like I could pick kind of a sweet spot in terms of like when or whatnot. But if you had to pick, do you think it'd be better for people to like do it maybe like, I guess the sweet spot's the perfect answer, but like, would it be better for people to do it too soon or wait too long? I would probably say too soon if I had to guess. Like it'd probably be better for them to like, move on, have the dog transition a little sooner rather than like wait too long. Because I had somebody like telling me like, she can walk in a wheelchair. And I'm like, I'm not putting my dog in a wheelchair every day. I'm just not doing it. We're not doing wheelchairs and diapers.
Well, and I think I think with Mia, her mind was so like, pop, 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 you know, just always going. And so I think to her to wait too long would have been a loss of her independence in a way that would have caused her a lot of anxiety and potentially caused some strain in your bond. Does that make sense? Yeah. And so I will always, and this may relay back to one of the questions that we talked about before we sat down, but, you know, myself, I am a person who learned from the first experience of waiting too long. My Rocco, my like soul dog, you know, the one that saw me through my young adulthood.
Yeah. When you got at 13, right?
Yeah. He was my world. Yeah. But he's the perfect example of, he had a chronic disease. Okay. So he had dementia at the end of his life. He was
dogs could get dementia.
Yeah, he had kidney disease too. Kidney disease seems to find all of my animals. I don't know why, but he had kidney disease. But his really the worst of it was that he had really advanced dementia at the end of his life. And so,
real quick, what is it? How does that manifest in dogs?
Yeah,
I know it does in humans.
Yeah,
kind of
similarly, believe it or not. Okay. I actually just wrote a paper on this. Is called canine cognitive dysfunction. We say dementia because it's more relatable to humans. Right. But canine cognitive dysfunction is often directly compared to human Alzheimer's because a lot of it is, from what we understand of the brain changes, the anatomical changes, it's very similar. So we're going to have atrophy of the brain itself. We're going to have potentially some plaques developing. The neurons are not firing like they used to, and that's very similar to humans. Right. And so what we see overtly is, initially it may be just the occasional urinary accident in the house, you know, kind of like sort of unlearning some behaviors, but not bad. Maybe occasionally seeming like they get lost or are confused or disoriented. Not any huge changes, but then as things progress, much like in people, there's memory loss that's very clear. They become confused about where they are, how doors open maybe. They may, for Rocco, he started just kind of pacing constantly, a lot of restlessness. And then we'll often see sundowner syndrome, which means that they are agitated and restless and alert more at night and during the day they're sleeping really heavily. And so it's this reversal of they lose kind of time and space. Rocco was to the point where he would urinate very frequently in the house. He was losing the ability to understand, I go outside and pee, but his kidneys were playing a part in that too, because he just couldn't hold it. But it was hard to see him being confused, not really recognizing who I was anymore. I'd come home and he would just be kind of like, what's up? They lose recognition. They lose the ability to express themselves like they used to. A lot of times we'll see that they're kind of in a depressed body state where their heads are low, their tails aren't wagging anymore.
Man, that's so sad.
It's a hard thing. It's a hard thing to see them walk through that.
Just like a grandparent or a parent,
Exactly.
or whatever it is.
Sensitivity to touch is another big thing. Like humans,
mood swings.
Yeah. I mean, mood swings can happen, but like touch, everything feels very big, so they will often like startle when you touch them or talk to them.
Yeah.
So all these things can happen just like in people, and so, but it's not a disease generally that they're going to have a sudden emergency.
Yeah, it's just a gradual change.
It's gradual changes, and it can go on for sometimes up to 3 years.
Do people, I feel like even me, knowing as much as I know about dogs, I feel like I might just confuse that with old age.
It absolutely, and there are a lot of things that kind of coincide. And I think it's fair to argue that without a diagnosis, without the MRI to say, yes, the brain is shrinking, you could debate are some of these changes old age versus cognitive dysfunction. There are actually online scales that can help with, like, survey scales that can help clients like kind of differentiate if this is true cognitive change or is it age related. And so it's tough sometimes to differentiate the two. But generally speaking, an old dog is generally going to still come try to greet you at the door. And that's kind of the easier comparison. The old dog who my hips hurt, but gosh darn it, I'm still going to get up and come meet you at the door and acknowledge you are my mama and I'm ready for my treats. My bucket for my treats is right there. Come on, help me out, Or, hey, I still need to go outside. Like, I'm going to stand at the door and whine and you're going to let me out. I'm going to go urinate and come back in. Versus a dementia baby, maybe kind of, you
Not
come in the
things.
house and you go, where the heck is he? And he may be in the closet, with his, that's where Rocco would sometimes just put himself, is in the walk-in closet staring at the wall, that was different, right? Like
that is very different.
That's not him. He always comes to the door. And then the whole, like, buddy, go outside and go potty. Go potty. That was a command. I always teach my dogs go potty. It's the best command you will ever teach your dog is go potty. But he was very good at that. And then toward that end of his life, go potty, but he's just kind of meandering, walking around the yard with not much purpose, just kind of in purple clouds. And then, he'd come in and go urinate directly on the floor, So it's those differences where it's like, it doesn't seem like they have choice anymore.
That's those are helpful.
That is.
So those, and I always say, if you have concerns about cognition change, talk to your vet, because there are certain even nutritional or supplemental things that we do find help, just like in humans, with keeping the brain happier longer. It's always a progressive disease, but you can do things to try to support their neurologic health. So anyway, like, that's what he was going through. And I was very clear, this is, we're in this final mile. Unfortunately, I did schedule his goodbye. I had a steak ready and everything. I was like, this is the day. We're going to let him go. Like, he's exhausted. His body's tired. His mind is gone. And my mother was like, yes, please. Because she was, at that time, his primary caretaker. I was in vet school. So
she's the one who got him for you.
Yeah. And so she was the one who was cleaning up after him. She was the one that was listening to him tip-tap around the house all night. I was coming in every weekend, but, I tried to, that's the other thing. Dementia, generally speaking, if you were to move them to a new environment. So I tried to get him to move in with me. And they feel so lost and disoriented. It's like, just like a person who has dementia, you put them in a new environment, and it's like, I can't cope with this. This is way too much, So that inability to cope with a new stressor, that's really that's gone. They can't deal with new stress. And so we tried it for about 2 days before I was like, nope, he can't. Like, he's beside himself. He won't sleep at all. He's not able to cope. So it broke my heart that I couldn't have him with me, but it was just not good for him.
Right.
But long story short, the family agreed this was the right decision.
Yeah.
I knew it was the right decision, but your heart doesn't always agree with your brain. And so I ended up canceling his appointment the day of. So his steak went uneaten. He was having a good day. He went to go for a walk. He slept better that night. And I was like, I just can't, But what that led to was 2 more weeks of so-so life. He had a good day, but that doesn't mean that his dementia was gone. It just meant it was a good day. And so, unfortunately, 2 weeks later, my mom called me and said, I needed to wait till the end of the day to tell you, but we said goodbye to Rocco today. And, we had a conversation, my mom and I had. I said, if ever he goes into some sort of bad place, don't wait for me, because I was 2 hours away at school. I'd have to drive in.
Right.
And I said, don't wait for me. If you ever think that he's suffering, let him go, even if it's without me. So she already knew that. And she said he woke up and he was just beside him. He wouldn't stop vocalizing. He vomited. I just knew it had to be today. I said, you're right. You're right. So I say that to, make it clear, nobody is immune from that grief. Nobody's immune from that desire to delay and delay and delay the appointment. But in answer to your question of, is it better to say goodbye a little too, what feels like too soon, right, versus what is too late, I will suggest try to be brave for them. Remember that too soon means too soon, feels like too soon to us, no matter what.
It's us thinking of ourselves really than what's in the best interest of the dog, isn't it?
Yeah, it's more about meeting your goals for that end of life.
Yeah.
For both of you, it was, you did not want them to go through undue or prolonged struggle.
Right.
Right. That's a goal.
Yeah.
And we have to make a conscious decision sometimes to avoid that.
Yeah.
But the funny thing there, Sally, that morning, I was going to call you and cancel.
I know.
Because I was like, oh, she's so much better today.
Yeah.
And if it wasn't for Zach saying she's no different today than she was yesterday, and it's not going to get any better.
Yeah.
So that's when I was like, yeah, you're right. And it was just me. It was like me looking after me.
And that's natural and that's okay. I will never blame anybody for waiting a little too long because I know how it feels. It feels like, your brain wants to believe that they're better today. So therefore we've got months or years ahead of us. But that's not the logic of it. The logic of it, it's okay for them to have a good day and we still say our farewells.
Yeah,
because,
absolutely.
Yeah, because the body is tired and the body is not meant to last forever. It's just not. None of us are meant to be here forever and ever. So, so to answer that, I would say veterinarians are going to tell you if they think it's truly too early. You know what I mean?
Yeah.
I don't think any vet is going to say.
And it sounds like you do.
Oh, yeah.
You go to people's
I don't
houses.
mind saying like, I think we should try X, Y, and Z first.
Right.
Or for my patient yesterday, like, no, I think we try chemo, like that's a big jump, but I'm optimistic at this point. And if we feel like this is the best route to give this dog the best possible outcome, then it's fair to say, let's try if the owner's willing, right? But if we are at a place where the line in the sand is there or has been crossed, or we understand that, for Cassie, her kidneys are not going to magically get better. For Rocco, his brain wasn't going to magically turn around. I should have listened to him more when he was clearly telling me, I'm really tired, Mom. Like, give me my steak. Let me have my walk. And now my brain has been changed by that experience. And I say now, if we can give them some of their favorites on their last day, whether that's food, whether that's going for that walk or that car ride, or going for one more, even a swim potentially if their bodies will allow, let's do that and let them be on their way with lots of love. And not, I will always be sad that I wasn't with my dog when I promised him I would be.
Yeah.
And that was kind of my goal, but I wasn't able to accomplish that because my grief kept making me push this away.
Yeah.
It's a hard reality to face, but it is one that we face with love first, right?
Yeah.
Yeah, and if you wait too long, I mean, you're kind of like you were describing. I mean, you're kind of dealing with like a different dog in the same shell as your former dog.
Absolutely.
I mean, pretty much with, sounds like particularly that disease, but like, I mean, even me with my dog, it's like she was still the same dog up here, but body wise, it was a different dog. She was a shell of herself in terms of where she was, by the end. Same thing with Mabel too. I mean, she was old and skinny and, and
people had said to me, and picking up on what you've just said, I think we as owners actually know when it's time.
Yeah.
And we, like you said, we just like, no, it's okay, a bit longer, put it off. And I think we spoke about it going, when it's time. And I kept saying to people, but what if I miss it? What if I miss it? And then the day she told me, I was like, there was no way I could have missed it.
Yeah.
So she let me know. She went as long as she could. And and that day it was like, I think I'm done.
Yeah, I've done a good job, and I'm ready to move on. It's the new adventure. They never want to leave us. Let's be very clear on that. I don't think our dogs ever want to leave us for any reason. But I do think that when their bodies are starting to become aware of their true limitations. They're living with either chronic pain or increased anxiety or like constant nausea, and we're trying hard to help them compensate, but they know something's changing. They don't want to reach a place where they cannot take care of us, right? Like that, I think that's what it comes down to. And I think that's why one reason they're very good at hiding their pain. They will push themselves a lot further. But that's why it's okay for us to step in and say, you know what, I understand that you would be with me forever, but your body is so tired, and I'm going to let you go from this world with love and dignity, not in a critical place, or not when our bond is strained, or not when I'm not with you. You know,
and that kind of is like the most loving thing you can do for the dog. It's a huge sacrifice for us as the human, but one of the most loving things that we can do for the animal that we love so much.
We will take on the hard so they don't have to. That's the way I look at it. And I ask my families to consider that when they are making this decision is, at this point, do you feel like the hard you're taking on is so that they won't have to experience hard? And if the answer is yes, then, I say, okay, then we're in the right place. You know?
I remember the day you came in, Mia was sitting, in between my mom who's in the chair and Sally was in her wheelchair, and she was on the back mat by the door ready to go
with
or
her
whatnot.
ball.
With her ball, just standing there, and you're like, it was kind of like you were like, are we sure we're putting this dog down?
For
and then
just
you
a
saw her
minute.
move, and then you're like, oh, okay, that makes sense.
Yeah. And also hearing what you had, all the things, you know what I mean? Like, you did everything for her to help her body compensate.
Yeah.
And you had clear lines in the sand, right?
Right.
And also seeing how I definitely could understand how, yes, I want to throw the ball a million times for her, but she is going to fall. She is going to hurt herself. Her legs are going to weeble wobble so bad that she could potentially really injure herself, And I understand that, especially now that I have a German Shepherd. I'd never had a working breed dog before this dog.
Something special.
That is a different mindset. That is a different brain that you're working with.
Oh, yeah.
And I think Mia would have been miserable if we had waited so long that her legs were not doing anything for her.
All.
Yeah, nothing for her. And to your point of her dignity, being clean is very important to most dogs.
Oh, yeah.
They feel
especially
a lot
clean
of
dogs.
Yeah. Oh, and just making messes in the house. Like they acknowledge that that's not what they're supposed to be doing. And so I think that's a very appropriate line in the sand, is saying we are not waiting until they have urine scald or are,
What is that?
Oh, it's just where, kind of like diaper rash, where they've just collected so much urine and feces on the back of them because they can't move away from it or they can't posture correctly or any of those things. Like, I hate when it happens, unfortunately,
Right.
but I mean, it breaks my heart to see that because like that means that they've just been kind of like dealing with that waste on them, and that's not fair. And I know y'all would never have allowed that to happen with your dogs, but there are some pets that unfortunately they've reached that place where they can do nothing for themselves any longer, and that's a very tough
just
place to be.
Made me think of this dog. I went over to this house one time to sell this family training or whatnot, and they had like a younger puppy and an older dog that had to wear like a diaper all the time, and he'd kind of poop on himself. And I was very admired their level of care and how much they were willing to do for the dog, but I was just like, it could not be me.
That's completely understandable.
Yeah.
Cassie, she wore a diaper for a short time just because she would, kidneys.
Yeah,
She just
Mia
dribbles
would wear a diaper
constantly.
at nighttime overnight,
Yeah.
so she didn't pee in the bed or something.
Exactly.
But like
You have some control.
all
but it's
the
not
time,
all the
all day,
time.
no,
Yeah.
and just leaking poop out of your butt at times. Just
that's too tough.
Yeah.
I agree because
they're a super sweet family though.
yeah. Oh, and people will. I've seen people who I'm like, my goodness, you have almost quit your job. You will just be at home 24 hours caretaking for this beautiful pet. And that's wonderful and that's special and that's, I will fully support that.
Yeah.
But I would also say if we are to that place where you are afraid to leave your dog because of something could happen, that's your gut telling you it's time.
Right.
It's not, if you feel like it is not safe to go to the
Yeah.
grocery store, we need to talk about that because
Yeah.
that's not quality of life for you or for that
Kind
I
of for
agree.
both of them at that point.
yeah. Yeah. And I was almost there, trust me. I mean, I was very obsessive about Cassie's care at the end of her life. I canceled all sorts of trips. Like no going out to dinner, just go straight home after work, but I was lucky because I have a partner who works from home. That was having him available to let her out more frequently or carry her down the stairs was like, I could not do this without him.
Right.
I can understand how people just kind of become a bit of a hermit for a while when they're taking care of their pet because it's just you don't feel like you're doing enough ever. You know what I mean?
I definitely prioritize that with like Mia towards the end of her life. Like I don't really want to go out as much or like do as much. Like I'd rather just hang out with the dog or whatnot, and it's like, but I didn't like cancel a whole life, but I definitely wanted to spend a lot more time, especially whenever you can visually see the end is coming,
Yeah, prioritizing that last stretch of life, I think, is very important.
Yeah.
I would say if you have a bucket list, gosh darn it, that's awesome, and you should do that. You should. I had a family once that showed me their bucket list, and it was just fantastic because, again, the dog had dementia.
Right.
I'm not worried about this dog suddenly having a respiratory distress episode. We have time, but we need to do this bucket list, over the next 2 to 3 months.
Yeah.
So it was great. It was a great bucket list. You got to have, you had like breakfast in bed with dad and got to go like bark at the ducks and what else did they say? I think they went to visit like a family member that he loved, I think like that's what we need to be doing and absolutely prioritizing that is huge. Doesn't mean we have to cancel our lives, but we can certainly, prioritize them to get those things done. I'm a huge advocate of taking all the pictures and spending all the time, especially in that last mile stretch with them.
Did I tell you about me and Mia's last hurrah?
With the day of or
No, this was the day of. We had a hell of a good
Yes,
day
you
too.
did.
We had a really good day. But no, 3 weeks before. I don't really take vacations through the year, but I normally take off like 2 weeks at the end of the year, like just before Christmas, like right after the New Year. And the year previous, we had went to Yellowstone, and I was like, we're going to take the same trip. And she was much healthier the first time we went. But the second time, I'd been praying for like 6 months, like, God, just let her last long enough to go on this trip with me or whatnot. And so anyways, the day after Christmas, loaded up the truck, and we drove to the Badlands in Yellowstone. And then the last day of the trip, it wasn't really the same because we'd kind of already done all that stuff the year previous or whatnot. So I was just like, God, I'm going to let you steer the wheel today. Where do you want us to go? And so anyways, get in the truck. And we just started driving through Montana, and then we drove through Idaho and just had all these like fun little stops. And then we stopped at the Tetons and stuff, and it was just the best trip ever. And then we got home, and it was just like this last like big like, I promised you I'd take you around the U.S. and like we did it one last time, and it was a ton of fun. It was a really good time.
Yeah. And as bittersweet as that can be sometimes, it's you're not going to get a chance to replace that. So that's incredible that you gave her that experience, because it helped her feel free in a body that was making her feel more, isolated. And that's amazing. You know, whenever we can give them life, do it, you know?
It was just fun too. Cause like the first time that we did the trip, it was just the truck. But then like the second time we did the trip, like I had like pillows stacked behind my seat in front of the back seat, so I could lay her dog bed so she could be parallel with the thing. Because like the first trip, she could just jump from front to back, no issues. But this time she couldn't, so she was laying on the bed and just right there, like right next to me, basically while I was driving and stuff. So
you met her where her body was. Does that make it's really important that we make those adjustments, because that allowed her to feel safe and confident in the car. She wasn't worried about falling all over the place. She was like, Dad, you're driving and I'm the co-pilot, and this is great.
Yeah. We had a lot of fun. Like I said, the trip looked a little different, but it was a lot of fun. Okay. So
it's when you introduced her to the wagon.
Oh, she hated the wagon.
She looked at I can just imagine what was going through her ears, because she looked at him as like, what the heck?
I'm not getting in that.
Yeah. That was, I will say,
used to it.
I will say, people kind of encourage me to like move my line, because I was like, I'm not putting the dog in a wagon. And then she bought me a wagon for my birthday and was like, put the dog in the wagon. I was okay, fine. And it's like, and now I was just walking the other day. I was like, man, I wish I had the dog in that stupid wagon behind me, because I didn't really like walking with it, but I was like, man, I wish I could be pulling her in the wagon, one more time. But
I understand that.
Same thing with the wheelchair. My parents, I said no wheelchair. My parents bought a doggy wheelchair.
She flipped it.
She did. And she'd just be like, what the heck? Trying to get out of it on her side. So, like I said, some people had me, encourage me to move the line a little bit for me. But we had a good time.
Yeah.
Well, moving the line for you just gave you a little extra time.
It did. Yeah. No, it did. I mean, and now looking back on it, I wouldn't have it any other way, So,
absolutely.
So I guess, that was on my list of stuff, and I wanted to hear that story, because you had mentioned it a couple times that day or whatnot. But how did you transition from like general practice to finding Labs of Love? Like, how did you hear about it and stuff like that?
So I actually, I knew I love general practice, but I just kind of felt like it's not exactly where I want to be long term.
Sure.
And with my public health background, I was like, I think it's time for me to get into public health. I still think about getting into the public health district of our profession. So I was actually at a conference. It's a national conference, and they hold it every year. And I was trying to get, veterinarians have to have a certain number of CE, continuing education hours every year. You were required to do that to maintain your license. And so a lot of us go to these big conferences and we sit in all the lectures at once and get it done. So I was at one of these lectures, and I started looking around, because they have booths. A lot of people will advertise their practices or products. And I was actually looking for the U.S. Army booth, because they were supposed to be there to talk to veterinarians about joining the Army. Military does accept veterinarians, again, for the public health aspect of things.
Yeah, I knew the military had vets for like working dogs in the military and stuff
dogs
like
in
that.
the military, or even like managing like food safety within the military. Sometimes the public health vets are very much needed in those fields. And so I was looking for that, looking, could not find them anywhere. It was like they had disappeared off just out of the conference, even though the map said it was supposed to be here. And I walked past the Lap of Love booth, and I was like, this sounds interesting. And I started talking I was lucky enough to have our founder, Dr. Mary Gardner, was there, and if you ever get a chance to meet her, she is her personality is like the sun. She can attract anybody to her. She's fantastic. And she was actually there, talking to vets about, would you like to, potentially join our team? And then I got in touch talked to this wonderful gentleman named Trent, who's been with us forever. And the next thing you know, they're like, yeah, we'll hire somebody in Memphis. And I was like, really? Like, Memphis is, kind of a, smaller city. And they were like, yeah, you can be the first one. I was like, okay. So I just felt very connected with Lap of Love right away, because of Rocco was my first teacher in that experience of walking through that end of life with him, and acknowledging that there are things I would have done differently, at the end of his life. And the ability but I had always said I wanted him to be at home. That was one of my goals for him, was that one of the doctors that I worked as a technician for would come to the house and help me say goodbye to him. And so Lap of Love just really clicked with me right off the bat because it met all those criteria. It met the need for sensitivity. It met the need for in-home for my best friend. And it was a place where also I did not feel like we were being rushed through our appointments. We were given the time and the energy resources that we needed to invest in each family. And so for all those reasons, it just made a lot of sense for me to start with them. And then training, I went to Florida to train because Lap of Love was actually founded in Florida. That's where it was started by two University of Florida graduates. And so that's our home base. So I actually went. We don't send doctors to Florida anymore to train, strangely enough, but we train them on site now. Going to Florida was just awesome, meeting the team and being trained by their doctors. And it was like, yeah, this makes a lot of sense. It just makes sense for me and my heart, where I want to be.
And it sounds like you were kind of like part-time-ish with them while you were doing general practice till y'all were kind of building up the book of business here and stuff like that.
Yeah, while we were making the transition, because
it's hard starting a new branch because we've started Wonder Dogs in a number of cities, and it's like you got to get it up off the ground.
It takes a little time.
It does take time.
You have to be not only trained, but there's you have to make sure your controlled substances are all in order. You got to make sure you've got everything you need at your house because we don't have a brick and mortar.
I'm just meant more in like marketing and sales, in terms of like getting clients.
I was so slow the first couple months that they were like, we hope you're gonna make it. Yeah.
Yeah. I didn't think about the drugs part, but you got to have the drugs and where
a lot of
stuff.
like I's to dot and T's to cross when you start your own business, as you know. But the
especially
market,
when you've got drugs though.
Yeah. And the market took time. That's actually how I ended up in Boston was because, I had been trying to get Lap of Love off the ground for about 9 months, and my partner got transferred to Boston. And while I think, I feel certain Lap of Love would have continued to support me here, they were kind of like, Boston needs doctors and they're very busy there. And so I ended up going to Boston for about 3.5 years. And then we decided to move back, and I'm very, very thankful because Lap of Love was like, you can try it again. And this time it has been much more, I think our need and the pet culture here, it's evolved, it has evolved. I think COVID changed a lot. It changed the game when it came to the appreciation for in-home services.
Oh yeah, for sure.
So I think COVID has kind of been impactful for a lot of, even you guys going to homes and doing training at home.
Oh yeah. Yeah, we were slammed
immensely. Yeah,
it was
sure.
crazy busy.
Yeah,
but to be fair, you could be a pretty bad business owner, and COVID with dog training specifically. I don't know about vet services, but dog training, and everybody was making money, it's a much harder market now than it was during COVID. But people did really appreciate the in-home piece for sure.
Yeah, so I think when I came back, it was like, okay, we can do this time, and now I feel a lot more secure about our availability because we have a second doctor. Hooray. So that means that we have...
I'm sure she's great too, but I was like, there's no chance I'm using that lady.
Oh.
There's no chance. I'm sure she's great.
Yeah, Dr. Deanne is wonderful, and she is, and it just means that we can be available 7 days a week now, which is incredible. Because I used to go on vacation and just panic because I would just hate the idea that somebody needed me and I was like
it wasn't there
away, so but it's so good to know also that having a second doctor means we needed a second doctor, and that means that we're okay, we're not going anywhere right now, and that helps me because for a while in the beginning I was like, I don't know if we're going to be able to stay open. We just aren't getting enough need. But again, I'm always happy when people say, we don't need you. I'm like, yeah, you're right. That's good. Like, that's okay.
Yeah, that's a great point.
I'd much rather know your pets are doing great and living their best life. So
yeah, that is ideal, I suppose.
Yeah, always. I mean, I've always said this, if I could make them immortal, I would. In a heartbeat. I'd put myself out of business. If I just had a little pill or a shot and they just live forever, healthy and happy, that would be amazing. But just, unfortunately, that's not how any of us are meant to live. We are always meant to go through transitions in our life. And what we can do is embrace them with love and grace and, try to make the best of every mile. So,
yeah. Yeah. No, that makes sense. I mean, I know for me and Sally, we know the answer to this, but to the people who maybe don't know or didn't even know this was an option as a service, why is doing in-home euthanasia much better than taking your dog to the vet's office?
So I think that's a very wonderful question because my answer might surprise you.
Okay.
My general answer is whatever your dog or cat needs on that day is what is best.
Okay.
And generally speaking, that means being at home. I would say 99% of pets are going to say, yes, I prefer my house over the clinic.
Yeah. Absolutely.
I prefer my home. I can stay calmer there. I can be more comfortable. Potentially, if I'm very sick, a car ride might be dangerous for that pet.
Right.
If they are experiencing very serious decline, like seizures or respiratory distress, putting them in the car, maybe worsening that emergency. So for all those reasons, generally it's because that's where we want to be with the family and we are most comfortable in our home. And that's always, if you talk to people about where they'd prefer to be when they die, the answer is never, at a hospital where I don't know anyone and I'm looking at the ceiling.
Yeah.
Not an answer typically.
Does
they
sound
want to
terrible.
be somewhere they feel loved, supported, and safe and comfortable. And that's what our pets prefer too. Now, is there the occasional dog that loves going to the clinic who every single nurse will run up and love on them and pet on them and it's like a party every time they go in? There sure are.
Yeah.
And if that last car ride and that last like hoorah at the clinic where everyone is celebrating that dog is where that owner feels is most wonderful.
Yeah.
100%. I'm never going to say, well then, no, we can't. I have to come to that. No, if that is what's best for that animal and they're not going to be nervous or worried, they're going to be excited to be there and they have friends and almost family there. 100%. It's whatever is best for that animal. But yes, generally speaking, being at home means we are able to be in our favorite bed or surrounded by all the people that love us, maybe in our yard or our garden, if that's where they like to be. And so it's just about being somewhere that we feel the love can be most present and there's less distraction and there's less worry and there's more focus on the pet.
Yeah.
I have been in parks. I have been in the backs of cars. I have been in all sorts of places because that's where the pet feels most comfortable and most at ease. And
That's
so,
sweet.
yeah, we're absolutely willing to make adjustments. There was one situation. We were going to go to the beach, and I was so excited to be able to be. This was in Massachusetts, where there are beaches. This dog loved the beach, and we had all these plans to go to the beach, but he had a bit too much of a decline, and so it was like, well, we can't we don't want to put him in the car to go to the beach, but we're going to go in the garden. And I was like, that's fine too. Like he's obviously an outdoor lover. Let's just be outside.
Yeah.
So, and that's. There are cases where being at home is necessary because my dog went down and cannot get up, and he's a 200-pound dog and we cannot lift him into the car. That's a logical thing to say, you're right, we need in-home euthanasia. But the bigger picture is, emotionally, it's safe.
How do you get a 200-pound dog out of someone's house? If they can't do it, I mean, I'm sure you're strong, but I don't.
I'm not that strong. Trust me.
Mastiff strong.
Not anymore.
I don't know.
Yeah, I used to do a lot of CrossFit to maintain
Nice.
my
Same. Back in the day.
Then I realized my back feels like it's going to break. I should stop that. But no, if we do have like a situation where that sweet baby is like really too big for me to move safely, the crematory actually comes and helps us and assists us.
Sweet.
Yeah, I've had. My biggest animal was actually a gigantic pet pig.
Oh, wow.
Yeah.
Oh.
Very large piggy.
I wouldn't even have thought that you could do that, but I guess it's probably no different to euthanize a pig than it is
It's
a dog.
I have seen all sorts of species.
With laps of love.
Absolutely.
Is it lap of love or laps?
Lap, like you're sitting
Lap.
on someone's lap. Yeah.
Okay.
Yeah. And so the company actually, Lap of Love does a great job of saying, hey, doctors, you can practice, like we have the same protocols. They want to train us on, we always sedate before we place an IV. Like
Right.
that's everybody does that. But when it comes to, hey, does every doctor feel comfortable seeing a canary for euthanasia, or do you feel comfortable seeing a turtle for euthanasia? The company does let us say, you know what? I don't feel comfortable with snakes. I
Ooh, I
don't think I
wouldn't
should be
either,
seeing a
Sally.
snake, you
That
know?
is my line of
Yeah.
defense.
So, but we absolutely get calls for all sorts of species. So for me, I'm open to seeing any species.
Anything you're not.
The snakes probably, like, it's
Have you
not,
ever euthanized a snake?
I have not.
Okay. I wouldn't do that either.
Yeah.
Personally.
Either.
Yeah. There's differences in
Just put that
reptiles
joker
are
outside.
yeah, well, reptiles are very interesting because reptiles' metabolism of drugs is extremely slow. And so it's really not that I'm worried about handling a snake or injecting a snake for euthanasia purposes. It is literally that they sometimes take hours to effectively pass away from that medication. Now, to be clear, they're not struggling. Like, they are in a la land. They are under anesthesia, but they're just like when they go, because they're cold-blooded, right? So just like when they go into hibernation and they decrease their metabolism, it's really interesting, but it just, for me, I'm like, I just don't want to worry about them for hours and hours. You know what I mean?
Yeah.
So it's really more the biologic aspect of it that I'm like, I feel comfortable administering and handling. It's just the time, you know what I mean? Like that, I just don't want to worry about them for those hours. So
Yeah.
I always recommend exotics, seek exotic veterinarians that know just a little bit better how to manage that situation. But I absolutely have seen guinea pigs, chinchillas, chickens, canaries.
I couldn't imagine paying for your service for a chicken.
I mean, some people are very attached to their chickens.
We have chickens, and my mom loves the
Yeah,
chickens.
your mum would.
Yeah.
I don't know.
Some of the, I mean, I've seen some lovely chickens.
They're so sweet. I love my
yeah.
chickens too. I just don't know if I don't know. Anyways.
I totally understand that. I totally get that. But yeah, it's rabbits are a very popular pet that we
Rabbits
sometimes
are real
have to help
sweet though
with.
too.
Yeah.
We had a couple bunnies at the house for a while.
They're good. I really like rabbits. They make me nervous because they, you got to be so careful holding them because
Yeah.
they'll hurt themselves.
Right.
But otherwise, I mean, I love having them around. I think one of my favorite clients was they rescued guinea pigs. And when I say they rescued them, they rescued a lot of them. So they had 23 guinea pigs. And so their entire living room was just dedicated to this massive guinea pig area. And all the piggies were just so happy. They were making all their happy little
Them
noises.
little chirpy noises.
They
So
were
did you just do one?
just one. It was a very senior piggy and clearly ready to go. Wasn't eating any longer, and
little fella.
was isolating himself, and it was time. But all the other little guinea pigs were just content as can be. And I was like, man, you guys do good work, because you don't think about rescuing guinea pigs very often. But they were good. They were a really sweet family.
Okay, just because I'm so curious, is it cheaper to euthanize a smaller pet than a bigger pet? Like a dog versus a guinea pig? I mean, clearly substantially less volume of drugs. And I imagine that's probably where a lot of like the cost factors, I mean, I know it's travel and your time and the drugs itself and stuff, but is it cheaper to euthanize like a smaller animal, like a hamster or a guinea pig?
So for a lot of reasons, and for that exact what you brought up there, the math involved in, and I hate to say math, but like that is kind of how I guess they look at it. So we don't our doctors do not set our own prices. That is the company,
That would make sense.
Kind of like making those changes based on
yeah.
whatever, their algorithms. But my appointment fee is a set rate,
Right.
regardless of whether it's a hamster
Or a Mastiff.
a Great Dane.
Right.
Now, what that does do is it eliminates the need to nickel and dime people for, let's say I am in a situation where I am with a 200-pound dog and I'm having to use like
A little bit
almost
more
a
sedative.
whole bottle of my medication. But that medication is, I'm just going to use a number, I don't know off the top of my head, but let's say that medication is a $90 bottle of medication. And usually I'd only use like 6 mils, but for this dog, I'm using like 20 mils of it. I'm not going to have to say, well, sir, now you owe me an extra $100 because
Right.
I've used the entire bottle. So it's pros and cons. I think that's why the company, and I guess I shouldn't speak too much to this, but from what I understand, the company is doing their best to not nickel and dime here and there. So that's
That
why
would
the
make
appointment
sense,
rate is
especially
set.
on such a rough day, where it's
Yeah.
like, by the way, we needed to use a little bit extra.
Right,
Just,
exactly. We try
Yeah.
very hard to not.
Yeah.
Once prices have been discussed with the family through the support center, I'm going to do my darndest not to say, oh, there's this.
Yeah. No, that makes sense. And the support center call was honestly amazing too. Like they were
Good.
just
I'm
so
glad.
sweet and like so caring and
Yeah.
why are you calling? Or, not only why are you calling, but so sorry you're calling us today.
Absolutely.
Like, just like little stuff like that,
Acknowledging,
And
yeah.
it's like, as somebody who also owns an animal related service business, you just like really think about like, man, these are a lot of like, I was very I noticed a lot of the details, that
Yeah.
like maybe other people wouldn't necessarily notice or something, but it was a very supportive, sweet call and stuff. But that was just something I was just wondering, just like if which makes sense that it would be, a set price for appointments. I just didn't know if it was like cheaper for a little baby thing versus a huge thing, but that makes sense.
There is, and to be fair, all this, our prices are actually online.
Yeah.
So if you go onto our website and you type in your zip code, there will be, here's what the appointment will cost, and here is what, cremation, whether you choose private or communal, will cost. Now, that cost does vary by weight.
Right.
So a little canary is not going to cost the same to cremate as a 200-pound mastiff.
Right.
That's going to be where things are going to be a little different. And so I tell families, and clinics, when I visit them, I say, if your clients want pricing information, they want to get a gauge of how much it may cost, the website shows all that information. And then, yes, our support center does kind of like, absolutely, if it's
Come up with a quote for you and stuff.
yeah, they'll be able to put more, if there's any concerns about like, I'm going, maybe I'm driving 80 miles instead of 20 miles, they may say, oh, yeah, there's a little bit of a travel fee, or, the great big dog that won't let me touch it, like that's going to be maybe a different fee if it's a very aggressive animal.
Sure, yeah.
So there's sometimes changes in costs there, but I will say, I think we work very hard to keep things as low as we possibly can, but with the acknowledgement that vet med, unfortunately, generally is not it's not cheap, I would say. But that's, I never want a family to, I really try to make it work for families.
Adding in for you watching, it is literally worth every penny.
It is. I was going to say it's priceless.
Yeah, I mean, it's really not that much
Absolutely
more than getting your
priceless.
dog euthanized at the vet's office. I mean, it is a little bit more, but it is worth every single penny. Cannot recommend it enough.
I appreciate that.
Just the experience from start to finish was literally, I mean, it was just, it's not great in the sense that you're losing your favorite thing, but it was literally as great as it possibly could be. So,
Well,
anyways,
I've always said to people, it was a beautiful experience, and it helped me at the other end recover a lot quicker,
Yeah.
because fear took over me at the beginning. But going through the process, you can't put a price on that.
No, I appreciate that. And that's always my goal. I don't ever
And
want it to be a scary
my
day.
experience was different to yours because I went for cremation.
right.
And Mabel left the house on a stretcher because, of course, she's like 8 pounds now of weight. And she was laid, and I remember this as though it was yesterday. So she was laid on a blanket with a pillow, with another blanket over her. And I was just like, what? Because that attention to, she didn't need a blooming blanket. But for me, it was like, oh, look at her all cozy.
Yeah.
Absolutely.
And it wasn't the end, but we all knew it was the end.
Right.
You know?
Absolutely.
And you were still talking to her.
Oh, 100%. I sometimes have to catch myself and be like, the client may not understand why you're doing that, but I
understood
talk to
it,
mine.
but the comfort,
Yeah.
and you was like, I'll take care of her. And I was like, I know you will. Because just that,
Yeah.
it weren't just like, let's just shove her on a cold stretcher and
No.
it was like unbelievable.
I'm always going to do it same way I'd want my own, right?
Yeah.
Treated. And so, yeah, absolutely. And a lot of families do some really beautiful things as well. Some things that take my breath away.
Like what?
So I have, not too long ago, I helped a family and we were outside because the little pet loved, and this was a small dog, and she loved to be outside. They had, they had horses on their property, so the horses were like kind of galloping around. But what was so lovely was that the family actually had picked all these flowers from around, I guess, their property, and had created this beautiful flower petal circle for her to be in while she found her way. And I was like, for me, I was like, this is so beautiful. I literally, it brought me to tears because the care that they took to give her essentially a goodbye surrounded by petals, and
Yeah, that's sweet.
that was very sweet, very, very thoughtful and precious. And that was how this dog had lived. She loved her gardens. So we're just going to give her a garden today.
Any other ones jump out?
Let's see. I mean, there's so many. I mean, the amount of love. People ask me all the time, well, how do you do this job all the time? Or
That
was one of our questions.
And other vets, oh my gosh, so many vets will be like, I could never do it. I'm in emergency and I'm seeing all this stuff and I could never do what you do. And I say, you know what? I get to see so much love every single day. It's not always, it's not the scary things that sometimes our brain creates in this time in our pet's life. It's actually really overwhelming love that I get to see every day. I get to see how this pet has been loved, evidence of that in their home. For Mia, it was like she had every opportunity for soft spaces and her ball and her yard and her chickens in the back, that she loved to kind of like keep an eye on. And for Mabel, it was like knowing that her favorite place was right by your side, clearly seeing that her home was for her, and not this, it's amazing to walk in and witness that. And in a clinic setting, you still get to hear the love, but you don't necessarily get to see that love.
And I have to imagine too that it's worse probably for a vet at an office because a lot of dogs hate the vet.
They hate it. Yeah. Like
Mia would have literally been shaking. Like she hated the vet's
I know.
office. And so I imagine, and then also too, I mean, like I imagine in your case, like you're a very niche service. So like you're doing like, despite it being what I would imagine being a tougher job, it's over and it's more, but if you're, a family vet and you've been seeing this dog for 10 years and then you've got to euthanize this dog and then you're going to see a puppy in the next room, then you're going to see a dog with, kidney disease and then another dog who, whatever, right? Yeah. And then you're just giving a dog a shots, right? And so it's like you've got to like task switch so much, which is probably really taxing on a regular vet, something that's not as niche as you are.
It can, absolutely. I mean, it's tough when you have to, like you said, go into a room and help. I can't speak to pets that I've taken care of for years and years because I wasn't in general practice long enough to have that puppy to senior relationship. But I absolutely think that rips vets apart when they're saying goodbye.
Like, gotta get to the next room, gotta get to my next appointment.
Yeah, and not because it's not right for the animal, to be very clear. They know it's the right decision too. But they, we think of sometimes we think of our patients as our own, if we've seen them for many times or we've been managing a chronic disease, it's tough on us too. Cassie, I actually, I'm so grateful still because her acupuncturist vet, who had been seeing
Same one
her.
or different one?
Well, Cassie, my blonde. Yeah.
No, I'm saying, was it like, did we use the same acupuncturist or were we using somebody different?
Are we able to do names? I don't know.
Dr. Fisher?
Oh no, yeah, I love Dr. Fisher.
Yeah.
She wasn't practicing at that time.
Oh, gotcha.
But
Okay.
no, Dr. Heather over at who's now at Healing Paws, which hopefully I can say that.
Yeah, no, that's fine.
But she
Is
was
that here locally?
Yeah,
Okay.
it's in Collierville.
Oh yeah, I know where that's at. Yeah.
Yeah, she was initially at East Memphis.
Gotcha.
Yeah, and so she was seeing Cassie for acupuncture and cold laser therapy for
Cold laser. What is that?
It's well,
I didn't mean
not
to
the
derail
special-
you.
Oh
I'm
no,
sorry.
that's
Forgive
okay.
me.
I'm not the specialist on it, but it's a form of laser therapy that we've seen can promote. Now I hope I don't misquote it, but essentially it's meant to help promote healthy blood flow to problem areas, and then cold laser can actually help with pain management. So for especially with like chronic ortho pain or nerve pain. And so it's great because Cassie was in kidney failure. I could not give her Rimadyl or Carprofen. I couldn't give her a lot of the oral medications because her kidneys would have reacted poorly. So we relied heavily on acupuncture therapy and cold laser to manage her chronic arthritis pain. And so we would go see Dr. Heather once a week minimally. Sometimes I'd sneak her in for an extra if she was having a bad week. But I was so grateful because the day that I knew we needed to let her be on her way, I did not want to play vet. You know what I mean? Like I was like, I don't want to be her doctor today. I need to be just mom. I don't
You mean
want
the day that you later?
Yeah. And so
I was going to ask that. I don't know if that'd be like out of taste to ask if that was like something that you did yourself or if you had like a colleague do it or something like that.
There are some vets, and I applaud them. They're like, nobody will euthanize my pets but me. And that takes a lot. I have euthanized some of my own, and the last one that I did help over the bridge was my like, okay, I'm not doing this anymore because that was my child, a Chihuahua that was my sister's. And so we had her for years. And, you know, I felt it was right for me to do because honestly, she was kind of a jerk, kind of a butthole. And so
she wouldn't have liked somebody else doing it. It sounds like,
she would not have allowed anybody to hold her, much less
Yeah.
give her a little poke under the skin. So I was like, I think I have to do it because I think she's going to bite anybody else
Sounds
who
like that was for the
tries
best,
because
then.
she's kind of a butthole.
Yeah, that sounds like that was for the best then.
Yeah, I love her to death, but she at the end of her life, she was like, touch me and die. And I was like, yep, you have a Chihuahua attitude about you now. But for Cassie, I just knew, I was like, I can't be the one to give the injection. I just can't. I don't want to be. I want to be in her ear, loving on her. I want to give what I give other people. I want to give her what I am allowed to give other pets, which is mom and dad are right with you. They're not focusing on a syringe, you know?
Yeah.
So thankfully, Dr. Heather was so kind and understanding, and she's, had been taking care of Cassie.
Mm-hmm.
Yeah, she'd been managing Cassie's pain for, I think, over a year at that point. And I know it hurt her, to see Cassie go as well. But I know she took that very much as an honor of like, I can help you with this, and this is the last victory I can help you give her. And it meant everything for me to have her with us because she was excellent, and Cassie knew her, right? So it wasn't weird.
Friendly,
yeah. She was like, I know who this is. You know, so.
Yeah, like you, I also asked my dog, the acupuncturist, to get to do Mia, but she was like, I don't have the drugs. Like,
it's a little different.
I was like, all right.
It's a little different. But that's why I always try to come in and, I know nobody knows me from whoever. So it's important to me that when I come into a home, I'm not just rushing in with a needle. I don't want that experience because that's not fair for the family or the pet, right? And that's why I will tell people, hey, you might have noticed I'm not reaching for him or her because I'm in their home. I'm not going to, I don't have a physical exam table to put them on. This is just, you're here. Let them evaluate who I am, and we'll move through things as we need to. Yeah. But let's not, I never want families to think that's what I'm going to do as soon as I arrive is just run in and give an injection. That's never the goal.
Yeah, well, that was definitely not what we felt for sure.
No, my experience. And to be honest with you, Sally, no, I'd never met you until that morning.
Yeah.
But the way you handled things, the way you were talking to Mabel, we weren't pushed, rushed, nothing at all. Yeah. It was as though I'd known you for years.
No, I appreciate that. Absolutely.
And you spoke to Mabel as 100%. Though you'd known her for years.
Yeah. Well, like I said, I've always related more to the pets.
Yeah,
So
'cause
I do
you were
feel-
talking to her, and you were saying things to her like, "Oh, I can see you've had a good life," and you were, and I was like, "How the heck do you know?"
Oh, I know. I mean,
But it was,
yeah.
and that was so comforting and reassuring for me, because I
Yeah.
was like, "Oh my goodness me!"
Well, and I honestly do. I'm not saying I'm a pet medium, but it's very clear when a pet has had a good life. You see it all over their face. You see it in the way that they hold themselves. You see it in the way that they're responding to a new person being in the house. Mia was extremely confident. She was an extremely confident, bright girl who obviously you filled their lives. You know what I mean?
She didn't even growl at you.
No, she
No,
didn't.
she
hated people.
growls at everybody.
Yeah, she got. I feel like she did grumble just a smidge, and y'all were like,
Barely.
"Grumble girl,"
Yeah.
like that was just who she is.
Yeah, no, she was a little grump.
Yeah, but that's okay.
But a little grumble
Yeah.
compared to how she did behave. She growled at me for years, even though she'd been in my company numerous times.
She did love Sally, though.
Well,
in the end.
Yeah. Oh, absolutely. I'm sure she did.
It took
absolutely.
a long time.
But that's exactly, even my dog, and I'm going to use my own animals, okay? Sam is a wonderful dog. I would never worry about her biting anyone, but she is a very intense personality until she can settle. And so to bring her into a clinic would not be my ideal for her last day. She'd have her guard up. She'd be, worried, even if her body was sick, And my cats, I will tell you right now, they do not go into a clinic conscious because they are dangerous creatures.
You
And
sound like you got some wild cats. You were
Yeah.
talking to us before we started recording. Your cats sound a little
They have bitten
crazy.
me many times at home, much less going into the clinic.
Yeah.
So
Yeah.
I love my cats. I will not ever get rid of them, but they test me, and so bringing them into the clinic, I don't care how sick they are, I would not want them to experience that stress.
Yeah.
For them, it's just
Yeah.
too much to go into a clinic when they're well, much less when they're not feeling good. So that for those reasons, again, I will
Yeah.
fully support and I want to be that family member for people when I come in, because I'm not here to rush you through it.
Yeah.
But everybody has different needs. One of the things we do encounter sometimes what can make an appointment tough emotionally is more so the people sometimes,
Yeah.
because
I'd imagine.
because there can be a
absolutely.
lot of variable emotions,
Yeah.
and those emotions can run very high sometimes,
Yeah.
which is understandable.
Yeah, I'll be honest. Once you got there, I was like, let's do business. Like we've had the day, we've spent the time.
Yeah.
Like I've anticipated this too long now. Like let's just let's not get it over with, but let's do the
Let's
deed.
move
That's
forward.
what we're here for.
Yeah, and that's okay. Totally understand.
Which I wanted to ask and follow up. Like, what do you think is your shortest appointment where you've been on site and longest?
Oh boy, shortest and longest.
I feel like ours was probably I don't know, but I feel like ours was pretty short. You came in, we chatted for probably 5 to 10 minutes. We did the deed. I think you were there max 30 minutes. Had to have been 30 minutes or less.
And I would say 45 is usually my average.
Really? Okay.
Yeah. I would say average 45. That is something that does depend somewhat on my client. You're absolutely right, Corey. And I will never say there's a right way or a wrong way to take the day on, okay? Because emotions are emotions. I'm never going to say emotions are wrong. No, emotions are what you have in front
I
of
had
you.
plenty of them as soon as you left.
Yeah, absolutely. And for somebody to give me the signal of this has felt like a long goodbye. No further words needed. We need to kind of move things along, and
Right.
that's okay, because that is what you need. The humans need, and maybe the pup needs it too.
Sure.
And it's okay to say, you know what, we are still enjoying a little time together. Can you slow down for us, or can we wait on another family member to get here? Has happened many times. That's okay too. We'll just settle for a minute, right? So, but different people need different things. Absolutely. When it was Cassie's day, I didn't mean to be rude to Heather, but I didn't say much to her at all.
Yeah.
Because I was like, let's go. I'm not going to be able to hold it together for very long. you
Yeah.
know? So I definitely understand. And I think it's just what the individual needs and what the family needs. And so my shortest appointment Oh man.
I feel like mine would be tough to beat.
Well, no. I think my shortest was probably about 15 minutes.
No way.
Not for good reasons, though. Okay, let's be clear. When it's extremely short like that, it's usually because I am walking into a situation where that pet is actively in trouble and we need to immediately get them peace. Does that make sense?
Yeah.
I need to move
Give an
fast.
example.
Well, seizures is a good example. So, or respiratory distress is a good example.
You said that a number of times. Just give me a couple ideas. What does that mean?
So, respiratory distress.
Yeah, like coughing.
Yeah.
hacking,
Well, no, not. I mean, I can slow
barely
down.
able to breathe.
Yeah, it's when they are clearly oxygen hungry and they are struggling.
Big breaths in and out, like they can't really breathe.
They
that good.
can't breathe well, and that's caught that the scary part for them is it is scary to not be able to breathe, period. So what you see is an animal that is panicked because they cannot get oxygen. And that's not a place I can leave them. I can't let them stay there. Does that make sense?
Let's skip the chat and just get to it.
Oh, and I will. Sometimes if a family says we need a doctor as soon as possible because they can't breathe or they're seizing or they're whatever, something is very wrong. I will absolutely, you guys probably either got a phone call or a message from me saying, I'm on my way, I'll be there in 30 minutes. If I get information that leads me to believe that this pet needs immediate sedation for their comfort, I will sometimes say, just so you know, it sounds like we're in a really bad place. I will have my sedation in my hand and you may see them. I may just give it immediately because I'm understanding that we are in a really uncomfortable place right now. And so, it breaks my heart when that happens because I would much rather be able to take a breath with that family and introduce myself and say, let's give them their special treats or let's be where we want to be. Sometimes it is just, we need to be wherever we are, and so that's one of the reasons, respiratory distress can happen because of heart disease. It can happen because of heartworm disease, pulmonary tumors, even bad nasal tumors. Nasal tumors are really tough sometimes because all the chest is working, but we can't get the air into the lungs. And so that's really tough sometimes. But any situation that could potentially lead us into the outcome of a severe respiratory distress situation with very few red flags, meaning the heart's working and now it's not. That's where I really try to encourage families to understand that being proactive can be very important because we may not have time, when things go wrong. And so that's why sometimes when I just have to walk in and immediately get to the medications, that can be a very short appointment, but it is for the benefit of
that makes a lot of sense.
Letting this, letting this pet rest, prioritizing getting them comfortable.
What's your longest one?
Oh, I think I've been in some that have been easily 2 hours. Wow. Easily. Yeah. Yeah. Because sometimes we have to have,
that time.
We have to have that time or we have to have a significant conversation before we let them go. You guys, I think everyone, a lot of people, and you guys particularly, we're connected with our pets. We have healthy attachment relationships with our pets. And so inevitably it's hard to say goodbye to them. But there are many of us human beings that we have what I would consider unhealthy attachments. And that may lead to the inability to let go of that animal. Even though I might be on my knees begging for you to say, let him go, because I can't legally euthanize a pet without consent, right? So sometimes we have to have a very long conversation about why euthanasia is appropriate, why it's fair, why it's loving. And that can lead to longer appointments, for sure.
That makes sense.
Yeah.
So in that situation, is it generally like another family member that set the appointment knowing that it's time, but another family member has this knee-jerk reaction to it?
It can be.
Gotcha.
Yeah, it's unfortunately, it's not unusual for that to happen, and it's not, it's okay. It's okay.
Yeah.
If we need to have a conversation, because there may be two people on opposite sides of this decision.
Gotcha.
Yeah.
Yeah.
Ideally, those conversations should be had before the day of.
Yeah, before you get there.
But emotions kick in, don't they?
Emotions kick in, or to case in point of my dog, he wanted to go for a walk today, so everything's okay. And it's like, we need to talk about that. Because but easily 2 hours. I think I've had a couple 3-hour appointments, but
What do you? I can't be the only person who's thought this. Have you ever had anybody back out once you give the sedative before you euthanize the dog? Because I'll be honest, you gave Mia the medicine, and I'm like thinking this was, because you let it sit for like 10 minutes or whatnot, and
you need to let her get calm.
check their pulse, all the stuff you did. Yeah. And I was thinking to myself, I'm like, you could stop this right now, and she would just have a hell of a nap. She would just have a hell of a nap, and then wake up and be a little loopy, and you can still have your dog. I can't be the only person who's thought that before. Has somebody ever like acted on that though?
No, I think there is. So I have one funny story that I'll save for last regarding that exact issue. I think that's very natural to have that response. I really do. I think to a certain extent I even had it, because I actually gave Cassie her sedative myself because I wanted her to get sleepy in my arms before Heather walked over. And so absolutely. Was I sitting there thinking I could just let her snooze this off? Now, as natural as I think that response is, I do think that it's important we acknowledge those medications are still significant medications. And, I would never feel comfortable leaving a home if I'd sedated a dog unless they were awake. Does that make sense?
Oh, wow.
Yeah. So, but the bottom line is, yes, in most cases, it is a combination of sedation that they would have received even for potentially like a big surgery, if they were having surgery. But as much as those emotions are real, and yes, people have expressed that to me, nobody has ever said, don't give that last one.
Yeah.
And I think that's...
Oh, I'm glad I didn't. That was a very real thought that I had.
I understand that.
Yeah.
We are looking for any reason to not say goodbye. You know what I mean? That's natural. But that's most often that's our grief creating deterrence, and creating boundaries. When in our gut, we know this is a goal. This is a goal. We are accomplishing a victory. We're not doing anything in malice, you know.
Oh yeah, definitely not.
And so, but yes, to the funny story. So I did have a client, again, this was in Boston, because they got wicked senses of humor up there.
They do.
But I had this wonderful woman. She was fantastic. Her little house sat right on the shoreline. So I remember distinctly she had these big bay windows, and she had this tiny little cat who was like 16 years old. Kidney failure, very, very common in our senior cats. So she had been managing her kitty for a while, but she knew it's the right time, So she actually had this very little petite senior cat on her chest, and I'd given her the sedative, and the cat was just falling asleep on her shoulder. Everything's beautiful. The sun is setting. And I had, I said, okay, well, I think she's ready to be on her way. So I placed her IV, and I started giving that last injection, which is just an overdose of anesthesia. To be clear, it's just a big overdose of too much anesthetic to let the body go so deeply.
Oh, there's not like a special drug.
Well, it's a special drug in the sense of it's pentobarbital. So that is a surgical anesthetic. You can't just buy it on the shelf. But
right.
But it is, it's just.
Is it the first drug and the same drug?
Mm-mm. No, they're two different. Actually,
so you put her down, you put her to the sedative is one drug.
The sedative is actually a combination of pain control and sedation in one.
Interesting.
Yeah,
okay.
So it's multiple meds, and I choose those anesthetic protocol for the sedation based on what I think the pet needs. So we kind of personalize those.
Yeah, I remember you said that whenever you would come over that
It's
day.
something that I want for every pet. So that is actually medications that are just going to sedate the body and relieve any pain. So it leaves them floaty, right? And then the overdose of that pentobarbital is what allows the brain to go so deeply to sleep. It's not unlike overdosing on, say, like Michael Jackson. A lot of people kind of go with that. Yeah. Like propofol, like Michael Jackson took too much of. Yeah, like that is what we're doing. We're creating an overdose situation because those drugs do not work at the heart. They work at the brain. They put the brain so deeply to sleep that the body just kind of goes, okay, we're off, like no more reflexes. So that's why it's considered a sleeping death, a good death, right? And so I was injecting this last need in medication, the pentobarbital, and the woman, this sweet client, looks at me and goes, "Never mind, I've changed my mind." And I just froze. Of course, I'm halfway through the injection. Like there is no going back at this point. And I just froze and my heart went into my throat and I felt like I couldn't breathe. And she goes, "Oh, honey, I'm just kidding you." And I'm like, I felt like I was going to faint, and I was like, "Okay, just so long as you know." And she's
Funny,
like,
funny.
I was like, "Okay." And we had a bit of a chuckle about it afterwards. And she was like, "I just thought I'd get you." And I was like, "You did. You got me really good."
Oh my word.
But she knew it was the right decision.
Yeah.
She was like,
Yeah.
"This is exactly how we needed it to be." She needed to be on my shoulder, and we loved on each other.
Golly.
So, yeah, but I was like, it's fine though if we don't play that joke on the doctor.
No, thank you.
Yeah.
That's a weird sense of humor.
Well, sometimes you have to have them.
Sometimes you do.
In the dark days.
But, oh my gosh.
Yeah, couldn't be me. Man, I feel like we've hit a lot of the highlights. I guess we had texted earlier this morning and at back and forth or whatnot, and I guess the last two I had on here to really talk about was like, I guess you've kind of hit a couple of your favorite ones that you've done, even more recently with the flowers and stuff like that. Some of your more favorite ones. Did you want to share like one that you have been tougher for you? Because I think I said whenever I originally wrote the question, I just meant more like, are there any that are emotional for you, or is it just work at this point, or and I imagine they're emotional. When I think emotional, I mean like crying emotional, versus, and I think you had kind of taken as like dogs that maybe were tougher.
Was tougher,
in terms of like the case itself.
Yeah, the logistics of it or whatever.
It sounds like you've worked with some aggressive dogs where you're like, I can barely touch the dog. It sounds like that one would be a tougher case as well.
I actually, so I wasn't sure exactly how much to touch on that because you guys you're a training facility. You don't want aggression to escalate. We want to be able to manage aggression I shouldn't say aggression. Most of that comes from anxiety.
We
all
don't
know.
train aggressive dogs.
No, okay.
We only train friendly dogs.
Yeah, but also when people say, "Well, what do I need to do when I get a puppy?" Training is always my answer. Sure. Training.
Yeah.
Exposing them to new things, building their confidence, making sure that they can be flexible in different environments as best we can. And again, having a working breed dog, I am like, please train them because the working breed dogs need that more than anybody.
Yeah.
So yes. But unfortunately, sometimes we do have the need and the responsibility as veterinarians to say, okay, we have tried a lot of things, but we have an animal that is overtly and dangerously aggressive. And they do, that's what we call behavioral euthanasia. And it is certainly something that is very difficult. I will be the first to say I have experienced or I've had to help families with behavior euthanasia out of necessity for the safety of their family, their other pets, and for that animal itself, right? Because I don't want an animal to be in a situation where there is now a serious injury, a bite, a lawsuit, the animal being seized, goodness forbid, those are the places we are trying not to get to. But if we're seeing that the behavior is escalating, there may be a need to say goodbye to that pet while it is safe and while I can come into the home and offer a peaceful and loving goodbye before something more tragic happens. And say those are very important things to consider. I will always recommend the family follow up with some sort of counseling because that is a tough decision to make too. And I want to be there to support those families. I have actually never had a pet. There's been one instance that I've actually been bitten during an appointment, and it wasn't a terrible bite, but it was for an aggressive pet. Thankfully, Lap of Love does have us fairly well trained on how to manage aggressive pets that cannot be leashed or handled. And so we have different protocols to meet their needs without distressing them. And I think that's a huge benefit of that training is I do not get scared when I have a family who's like, my pet has, been aggressive for the first 2 years of its life and now they can't be touched, So we'll find a way to manage that pet and then do it in a way that is as gentle and as easy for that animal as possible. That's always my priority.
Yeah.
It's just a really tough day for the families. It's tougher for them.
Yeah. That a young, healthy dog that's just rude.
Yeah. That
Or something's wrong with it. Yeah.
Well, and sometimes our brain is wired differently. We're still learning about what triggers aggressive behavior in dogs. And a lot of it can be genetic, or it can be even due to the fact that the mother was highly stressed during pregnancy.
I say that all the time.
Yeah.
Nature versus nurture. Even if you give the dog a great nature, the nurture, if a dog's stressed during pregnancy and the feeding period and things like that, all those stress hormones pass the puppy. And so you can do everything right. We just did a whole podcast on socializing your puppy. And I'm like, at the end of the podcast, I end the podcast with like, guys, I just want to say, you can do literally everything we just said and still end up with a dog that is genetically nervous and scared and reactive and nervous and stuff. And it's like, and that is something that takes time to fix.
Yes.
If it is fixable.
If it's fixable.
And there are a lot that are, because like Mia was just like, she was a bag of nerves her whole life. Like super loving to all of her family, but like just did not like people most of her life until the end of her life or whatnot. And it's like, I have a feeling, I know a lot of that came from just bought it from a backyard breeder. I was very naive when I was young. I didn't know what I was getting into,
Yeah. Oh, I get that.
Yeah.
I think that's going to hopefully become a more popular school of thought where when people are trying to diagnose behaviors, especially with rescue dogs, especially with rescue dogs.
Yeah. I mean, I have no idea my dog's background.
Yeah.
Literally found her on the street. Who knows where she came from? Who knows who her parents were? I know nothing.
Yeah.
But I do know she's a very smart dog, but she is just not one to snuggle. She doesn't like to be overly touched or handled. I don't think she'd ever bite anybody, but I will never say every dog is capable. Every animal is capable of biting.
Yeah.
And so training for her was, I could literally see it is essential we get her in training because I needed her to build up confidence so she could travel with us. We can have the cats in the house. We can potentially get another dog. If I sincerely think if we had not intervened in her, behavior earlier, or if we had not done that, we'd be in a very different place where she probably wouldn't leave the house just out of like, she's just going to bark and lunge, and not be bitey, but just be flighty, run away, I will say that's my biggest fear with her is if she ever gets away from us or we get separated, she's not going to go to anybody else. That's what terrified. That's why I'm like microchip, we have to have some way to track her.
Air tag, air tags,
that. She would never bite anybody, but she's going to run away from you. And so I'm sorry, going back to the original question. Which was?
I don't remember it. I was actually going to compliment your ability to weave because like you've got I've been so impressed multiple times a day with like your ability to like be answering a question, go off to tell a story and then come back to the original question and answer it. That's a real unique skill set.
Well, I think that's what you were asking. What was a tough one?
Oh yeah.
So the logistics of an appointment, after 9 years of doing this, I feel like bring it. I can figure out the logistics of things fairly easily and feel confident in my ability to carry through and keeping in mind gentleness, comfort, compassion at the front end. That's the goal. I think for me now, the tough appointments are I really struggle with situations wherein people are by themselves. I will always recommend. And I know I'm a person who grieves alone. I don't like to grieve publicly. I don't like to show my emotions significantly publicly if I'm hurting. But I will always recommend that if people are in a situation where they're saying goodbye to a pet they love, please call a family member. Please call a friend. Please call a coworker you feel you can trust. Have somebody with you that can they don't have to be your therapist, but just to be present with you. Because those are the appointments that break my heart the most generally folks that I can clearly see need support, but just don't have any. And so, you asked me to think of a particular one. For me, it will probably always be this young woman. I think she was maybe 17, but she was living in a halfway house. She did not have family, other people living in the halfway house, but they're not really friends, and she had agoraphobia. So her dog was her entire life.
What is agoraphobia?
It's a fear of large place, like open spaces.
Gotcha.
So you prefer to stay in your home. You don't really
bubble.
like to go out and be, it's just,
Now that you say it, I know it.
yeah, it's a type of social anxiety, sort of.
Right.
But her dog was, we can say our dogs are the best parts of our life. And that's probably very true, But for her, this dog was it, like this is her whole world. This is the only living being in her world right now. And so for me, when I came in, she was very polite and very, very sweet, but I could tell that there was nothing I was going to be able to say to in any way help her through this. Does that make sense?
Oh, yeah.
Because so that is one appointment that I knew euthanasia was the right decision for this animal, clearly struggling in his body. But for me, it felt like I was taking her whole world from her. And that was something that any vet will tell you, we don't want to feel that way. And it was right to do what we did for the animal. But for her, that was, I to this day, I hope she's okay. I left her my number and, resources and things like that. But there's not always going to be an easy landing for people. There's, we will always walk through our grief. But having a support network, especially when you have been managing a chronically ill pet, can be incredibly important. So I will always recommend that, and I'll always recommend seeking counseling services if you feel you need it, because pet loss grief is very different from human loss for a lot of different reasons. But Lap of Love does offer counseling. You don't have to be a client of ours. The website is available, and there are free services, and then there's one-on-one services.
I was going to say, don't you have like a group, like a support online group or something?
Yeah. And there are, I would always recommend, because you guys have a wider audience than just Memphis, seek out in-person groups. There's a lot of, some specialty hospitals will have counselors that have in-person support groups that meet, weekly or monthly. So it's really important that people have some form of outreach and support during that time, especially if they live alone and do not have family or friends that are nearby.
Yeah.
So,
because we're social creatures just like dogs,
We
We
are.
need people. We need connection and stuff like that.
And I understand wanting your space when you're grieving, 100%. But that doesn't mean that you shouldn't have somebody to at least knock on your door and say, I'm just coming to check on you, know.
I remember after I went just walking through the woods, I walked like 7 miles. It took me like 2 hours, something like that, 2.5 hours to just walk by myself in the woods for a while. Man, well, I guess.
But that is a different reality to what you told me years ago because you were like, when it comes time for me to go, I'm just like disappearing. Nobody will see me.
I was a little dramatic in my younger days.
Really?
Just a little bit.
Just a little. But at that point in time, that's who you were.
Yeah.
And you were like, I don't want to speak to anyone. I don't want to see anyone. I'm going to go. Nobody will know where I am. Blah, blah, blah.
I don't remember saying all that, but.
You were just like, I'm out of here.
Yeah.
I'm gone.
Yeah, I mean, I probably would. Yeah. Anyways, but yeah. So, I guess, do you have anything else you want to add to the show? Or questions?
Well, just as a follow-on, because again, you buried Mia. I had the cremation side, and that process as well was so professional. Of course, I didn't have any hand in all of that, but and it sounds really weird. And I've when I talk to people about this, because I've talked to many people about Lap of Love, by the way, I should get myself a little advocacy job. But Mabel came back to me in the most beautiful gift bag, which sounds terrible, I know, but the amount of love and attention that went into getting her back to me was just like, poof. Beautiful bag, beautiful box. She sits on the mantle. She's got her angel next to her.
Oh,
but even that, and then the crematorium followed up and said, did she come home okay?
good. Yeah.
I'm like, what the? I said to people, and I still believe it, I had a better service with my dog than some humans do burying their relatives or cremating their relatives.
I'm glad to
That's
hear that.
how, from beginning to end, this service was just like, blew my mind.
Oh, well, I appreciate that. That's good. I appreciate that. Yeah. I know. Mabel's such a sweet girl.
Absolutely.
Yeah.
And he sent me the most beautiful tribute, which I still listen to.
Just like a montage of like pictures and videos of Mabel and stuff like
From
that.
growing up. It was just amazing.
I love that.
Yeah.
Sweet girl. Oh, my gosh.
But you had a lovely tribute as well.
And we,
I did, yeah. Yeah, we, my parents made a hell of a shadow box. I got to show it to you.
Oh, I
yeah,
love
they had
that.
Yeah,
like, just so much cool
gorgeous.
stuff put in it. But yeah, no, my dad, I wish I'd had a shirt made before the show and I could have worn it today. But yeah, he had me like a Mia logo made for Wonder Dog because she's the original Wonder Dog
she's
or
the
whatnot.
one- yeah, she's the
dog and
silhouette,
logo. And so, yeah, anyways, but he made me, this was a Christmas present, but the shirt and the video, it was the song like This Is How Legends Are Made. And it's just like pictures of videos of her whole life and stuff. It was really cool. Yeah.
I love those. And the keepsakes are extremely important.
Yeah.
Yeah.
Right? And again, everybody's going to be different in how they need those things. But I'm a huge advocate of expressing that love in some tangible way. It doesn't have to be forever. You know what I mean? Like sometimes, you know, families will say, well, I think we want a little bit of their hair. And I'll say, absolutely, we
Yeah.
can save some of that. And if a family says, well, we'll probably do a shadow box or we'll make it a lock, you know, we'll put it in a locket. These things can be very wonderful and helpful. And then I'll tell people, you know, if at any point you feel like you don't need to hold on to this anymore, go for a walk in the woods, give it to the wind, let the
Yeah.
birds, you know,
Yeah.
put their hair in their nests
Yeah.
or leave their paw print somewhere where it will just go back to the earth. If you feel that that's what you need for your healing, that's fantastic. I'm still working on getting a piece of jewelry made for Cassie with her ashes because I'm like,
Yeah.
I know I want something, but I just haven't seen that right thing yet. That perfect
Yeah.
thing for
Yeah.
her. So I think that's fantastic. Shadow boxes are wonderful. I'm guessing the Mabel montage, is that a video?
It's a video. I
A
made,
video.
yeah.
So it's like one of those frames that keeps.
No.
Oh,
It's
it's
like just a video I made on my
Just a
phone.
video.
I texted it to her.
Oh, okay, wonderful. So
Yeah.
that it's just on, you
Just
can see
with
it
me
anytime
all
you
the
want.
time.
Oh, I love that. I love
Yeah.
that. And yes, we do have technology to like kind of pop up with, oh, this time 2 years ago, and
Yeah.
you're like, oh
Yeah.
man, you know. So
Yeah.
I
I've been
know.
carrying around this little piece of foam with me all the time. I've got a bunch of foam in my shadow box, but one thing was she had the bite sleeve, you know, right before you put you'd given her the sedative, but before it kicked in, she did her last bite. You know,
did.
she had that sleeve for months and could have torn it up at any time, and she tore it up like 2 days before she passed. You know, she finally started pulling the foam out of it and stuff. And so, anyways, I kept some of the foam, and I've been carrying that around with me. One piece of advice I'd give to families is like, don't change anything too quick. You know, like because I remember when I went in, like I don't remember. It was just like I don't remember why I felt this way, but I walked in my house and I was just like, well, she's gone now. Might as well like go ahead and pack it all up, you know. And so I started like cleaning up all the foam and threw it all away and stuff. And then like the next day, I was like, maybe I want to hold on to some of the foam, you know?
Yeah.
And so
Yeah.
not give away or throw away all of our toys or whatever
Yeah.
it was, you know? So just don't change anything too quick, folks.
I would agree with that. And I would say also, it is very much okay. I think one thing I struggled with a lot was for both Rocco and Cassie, I struggled with pulling up to the house because that was prime time. You know, that walking through the front door was prime time for both of them.
Yeah.
Rocco at my parents' house and Cassie at my home. Cassie was always at the top of the stairs, you know, tail wagging, ready to greet me. Rocco was always at the front door, which was all glass, so I could see him before I saw anybody else. And so I think, you know, I hear it all the time. I don't know how I'm going to come home tomorrow from work. I acknowledge, that's tough. And my best advice there is when you're struggling to kind of come back into the environment that you've shared, except, you know, now it's just, you know, it's just me, or it's just me and my partner. Cassie's not there. Give yourself some grace, park the car, and just understand, you know, have that moment of meditation or have a little cry. Give yourself that permission before you go in the house, because it is hard. It's hard to walk in and realize that they're not there. And sometimes I think it catches us off guard. You know, sometimes you walk in and you're just taken aback by the fact that they're not there.
Yeah.
So I think that's important, and I totally acknowledge that was probably the thing I struggled with the most, was walking in the door for months afterwards.
Sometimes you don't know what the trigger's going to be either, do you? Because I said to Corey, the longer it goes on, it's not that you've forgotten, you just deal with it differently.
You do.
Because I can remember the time I was vacuuming and found Mabel hair, and it was like, woof, here
apart,
it comes.
yeah.
And I would say to Corey, I said, just go with it.
Yeah.
Let it happen. Acknowledge
Absolutely.
it, face it, move on.
Yeah. Don't fight that emotion.
Don't fight it. Don't let,
Yeah. It's not meant to be a bad emotion. It's just
No.
love. It's love coming
Yeah.
up, making itself known.
Yeah.
It's always there. That's the thing. You
Yeah.
know, it is constant. It's constantly right there. It's just sometimes our world, you know, kind of just boop, pushes us over.
Remember me.
Yeah, even if it's just driving past the park where they love to go and just being like, dang, that was our favorite spot, you know? So absolutely, I think that is, and it's incredibly important. And what I try to do is I try to say, okay, baby girl, you wanted to show me something? I see it. I see it. I see you. You are right here. In some way, shape, or form. And yes, hair around the house. I mean,
me too.
We have moved, homes, and occasionally I will still find her hair, you know, in a book that I haven't opened in years or whatever. And I'm just like, girl, your hair literally was everywhere. Like, nowhere safe in this house. So yeah, I definitely acknowledge grief is tough, but grief is also something that can be extraordinarily beautiful, because it's that love that is still
What
with us.
was your saying?
Oh yeah, I was just about to say it. My fiance, it was a big month. You know, dog passed, and then 3 weeks later got engaged, and
It's exciting.
it is. But my fiance said that grief is just love with no place to go.
100%.
And I was like, oh yeah, that's so right. Because like for example, I haven't been able to take on my phone. I haven't been able to take me into the park off my daily to-do list. You know, because I have like a handful of things. Like by the end of the day, I'm going to do these things 100%. You know, and taking me into the park and doing the bite sleep with her was just like I just haven't taken off the daily to-do list yet. You know, I don't know when I will, but
no, it's okay. You don't have
And
to
you don't
ever.
have to.
You don't have to
I
ever
guess
if
I
you don't
don't.
want to.
Yeah.
I mean, Cassie's jacket, her favorite little green jumper she used to wear, because when she got so skinny toward the end of her life, you know, she loved having a jacket on her because it was just warm. I will not give that to Sam. That is never going to be Sam's jacket. That's always going to be Cassie's jacket. And it probably is not going to go anywhere. Like I think the best I can do is I've decided I might try to like make a small pillow with it or something that can, you know, be more not just a random jacket, the little hoodie. But it's okay to think of those things even, you know, years down the line when you're like, you know what, I can come up with a creative way to celebrate this little item that I just don't want to part with. And that's okay. But, you know, never, like to your point, never, try not to rush into changing everything or getting rid of everything. It's okay to pack them away. It's okay to kind of say, I need a minute here. But yeah, try not to rush that grief because it'll catch up with you one way or the other, you know?
And there's no timeline.
No.
Is there no timeline on grief?
And I think it's important that we understand that when our pet's body is no longer challenging them, the urgency is gone. Does that make sense? Like the rest of it is for us, whether that's doing memory pieces or writing poetry for them, or even sometimes a family is not quite decided on how they want to take care of a pet's body. And I say, you know what? We're not going to rush into that decision. Let's just take a step back. I'm going to give you guys about 20 minutes. I'm going to step out and then I'll come back in. But our struggle is over in our body. Everything else we can take time with, right? So we just need to acknowledge, like, I'm going to step out and y'all are going to have a conversation. If I have to be there for an extra 20, 30 minutes, that's okay.
So be it.
Right?
Yeah.
You know? So it's nothing's ever meant to be rushed, especially grief.
Yeah.
So,
Well, once we did a podcast on, our advice on losing a pet. Well, it was one of the questions we did on the show. This was 2 or 3 weeks ago. So if you want to learn more about that, I'd go watch that episode. But, or by the time this comes out, it'll have been like 6 weeks ago. Anyways, but the biggest one for me is just like leaving her little voicemails. Like I'll just pray and say, God, can you tell her this for me? And I'll just like leave her little voicemails and stuff like that, and that's just been the sweetest thing. Just like, I don't know. I don't know how I feel about like talking to like a dog spirit or something, but I'll just pray and give her a little voicemail, and that's just made me feel a lot better because, that's been the biggest one for me.
Yeah.
Anyways, well, I guess we should start tying a bow on this. If people want to get a hold of you guys or Lap of Love, just anywhere, I guess, in the country, I don't know where all y'all are at, but it sounds like quite a few places.
We're a little bit of everywhere, yeah. And so my best advice is, because again, wide audience, I don't want to give individual phone numbers, because we do have various phone numbers across different states, but they'll all bring you back to the support center.
Right.
So the best place to start is the website, which is just www.lapoflove.com. And like I mentioned a little earlier, what generally is the best way to search us is go to that website, plug in your zip code, and then what will come from that is if we're available in your area, number one. And number two, you'll actually get to see the doctor's profiles that work in the area. We have little bios on there. And you can, like I mentioned earlier, just check to see what is potentially an appointment cost or cremation cost. Also on that website is a lot of the helpful resources that we talked about. There's links to pet loss grief support. There is educational sections on like common cat and dog diseases, and some ways that, hospice management, acupuncture, pain management, all the things that both of y'all did for your sweet babies. But there's informational sections on that. There's even the canine, there's not canine feline, but there's quality of life scales on there that may be potentially also helpful to families that are really struggling with the decision-making process. So there's a lot of great resources. It's all there, and it's definitely the best way to initiate that contact.
Sure. Well, we both can't say thank you enough. For one, just for coming out, but then two, doing what you did for both of us is, real sweet, and just great experience. Like I said, for it being such a, awful
something
thing.
so traumatic was quite beautiful.
Yeah.
Well, I appreciate that.
Yeah. Well, guys, if you want to get a hold of them, we hope that this has opened your eyes to a different style of service. I'll be honest, until Sally did, I didn't even know this was a real thing. So, but it is, and it's, I can't recommend it enough. And I know Sally can't either. So
I tell everybody, we've even gone out to do events, and people have come up with elderly dogs, and they're talking like, oh, we don't need training. We're looking at, end of life. And I'm like, I'll tell you who you go to.
Oh,
yeah.
Well, I appreciate that.
She's been y'all's biggest fan since she met you guys.
Very much my honor to help not only you guys, but every family that I've helped. And I do. I understand. Trust me, I do understand. It's a hard day. And that's why I want to be present for my families who need me, because to understand that pain is to understand how to best support somebody in that pain. And so, you guys did the very best to give Mabel and Mia not just their victory at the end of life, but their entire lives.
Oh, yeah.
And that's an incredible thing. And that's hard work. It's hard work to be a good dog owner. It's not a passive thing. You have to be present and engaged. And your dogs, don't even want to call them dogs, your best friends, right? Because I don't think either one of your dogs knew they were dogs. I hate to tell you.
Oh gosh, no.
As far as they were concerned, they are a part of the family, you know? And so that's a fantastic way to live, is to have people surround you that love you in the way that you both loved your girls. So that's amazing.
Best life, the best life.
Mm-hmm.
Well, do you have anything else you'd want to add?
I don't have anything else I want to add. I still have plenty of stories, but I know we've talked a lot today.
Yeah. Well, guys, once again, if y'all are interested, go to lapoflove.com. Can't recommend the service enough. And you can get your dog trained, and that can get you some peace. But the only way to true peace is with Christ Jesus. And we will see y'all in the next episode. Bye.